Hello, everyone. I hope you guys have had a restful beginning to your week. Good morning, good afternoon to you, depending on where you're joining us from. My name is Noor Saeed. I'm an undergraduate student at the University of Toronto and recently joined the ABRAR team as an In This Together mental health advocate. But more importantly, I will be your MC for the In This Together campaign national conference. So the ABRAR Trauma and Mental Health Service is an organization dedicated to providing affordable, trauma-informed, art-based, and culturally sensitive mental support for diverse newcomers and immigrant populations. In the past, we have put together some amazing projects such as the Brave Space and Friends and Coffee. And one of our biggest projects to date is the In This Together campaign. I would like to welcome you to the Together Towards Recovery Conference Part 2. We're here for an important cause. I want to give a big shout out to the amazing team working behind the scenes, or should I say behind the screens. We are all here today because we recognize the importance of raising awareness about the current gap in mental health services for marginalized youth, including members of our BIPOC, newcomer, disability, youth in and from care, and LGBTQ2S communities, and provide resources for support. The goals of this In This Together campaign is to raise awareness on COVID-19's impact on the mental health of marginalized youth while learning more about the service gaps they face. We want to promote accessibility of mental health care for marginalized youth. We need to highlight the importance of early intervention as a stepped care approach for mental health care during the pandemic. And we need to create a multi-sector, multi-service, post-pandemic mental health recovery plan for Canada that is inclusive to marginalized youth. We're here to spark conversations between young people and decision makers, and most importantly, we are here to inspire action. Before we go any further, I would be honored to offer a land acknowledgement. It's important to recognize the people in this conference, the speakers, the guests, the participants joining from diverse Indigenous territories, including treaty territories, unceded territories, Inuit, and Métis homelands across Turtle Island. I'm speaking to you today from the city of Takaranto, commonly referred to as Toronto. I would like to acknowledge that the land on which I'm situated on is the traditional land of the Tetun, Huron-Wendat, the Seneca, the Anishinaabe, and the Mississaugas of the Credit peoples. Today, the city and Canada as a whole is home to diverse First Nations, Inuit, and Métis people. We offer land acknowledgements to recognize the communities which existed before us and the land we have the privilege of residing upon. It's important to remind ourselves that this land does not belong to us and acknowledge our positionality as settlers on Turtle Island. Now, on today's agenda, we have some exciting and hopefully informative presentations to look forward to. Firstly, a keynote address by ABRAR Mashmashia, and I'm so excited to announce that the following keynote, we will have opening remarks from the Minister of Mental Health, the Honorable Carolyn Bennett. Afterwards, our research team will present their findings. We'll do a comedy performance by Falafel Kimchi, hear some recommendations from a panel of very inspiring youth leaders, and we'll have a little musical performance followed by a networking event. To end off the conference, we'll be having a mental health activity to spur some reflection on our individual mental wellness. It's an exciting day, everyone, so let's jump right into it. So before introducing ABRAR, there are some important points I would like to highlight. This conference will be recorded. If you don't feel comfortable turning on your camera, there's no pressure to do so. And the information and experience shared may be difficult or unsettling, but we strongly encourage you to take care of yourself and reach out for support should you need it. You can reach out to our admin, Fatima Ahmed, through the chat option, and she will directly connect you to someone from our professional team. And with that being said, I'm very, very excited to introduce the woman behind it all, the founder of ABRAR Trauma and Mental Health Services and the leader of the In This Together campaign, ABRAR Mashmashia.
Thank you so much, Noor, for such a lovely introduction. And we are so sorry for some people because I think we ran into some technical issue with the limit we were not aware of. So please forgive us for that. Thank you so much, Noor, again. And I'm so happy to have you today with your lovely and beautiful spread emceeing today. Salam, marhaba, bonjour. And good afternoon, everyone. Thank you so much for joining us today. And we hope that you're having such a lovely day. I'm joining you today from Sagas, from the office, situated upon the traditional territories of Huron-Wendat, Haudenosaunee, and Anishinaabe, including the Mississaugas. we are extremely proud to be hosting our National Youth Mental Health Conference again during the pandemic to discuss recovery beyond COVID. And I want to start by sending such a special thanks to our sponsors for their generosity, YWCA Hamilton, the Student Commission of Canada, and Bellet's Talk, where it's worth mentioning that today is Bellet's Talk Day, where we remind the public of the importance of expressing our feeling and prioritizing our mental health. So, and we also want to extend our gratitude to our partners and supporters since the beginning. For today, Jack.org, Kid Health Fund, CMHA Bill Dufferin, the Mental Health Commission of Canada, YMCA Canada, and the New Mentality, BAM Collective, and Youth Gravity. Thank you so much for your continued outstanding support. Also, today's conference is providing simultaneous French interpretation by Barbara Schoffer Clinic. Thank you so much for your support. And today our tech support is being led by our lovely friend Laila Mansour, and the Canadian Arab Institute led by the great Jasmine Hawamdi, and to everyone behind the scene. So we created this Together team back in February 2021. We are close to celebrating our first anniversary. This beautiful journey started with the volunteers of young mental health professionals and students who advocated for mental health support, which is especially important during and after such a traumatic pandemic. To get where we are today, it took a year of devotion, advocacy, and never giving up on our vision. We have been working around the clock for months. Our research team, which I really want to do such a big shout out for, is relatively new to conducting and leading a research project or organizing a conference. For that matter, a side note that speaks to this is that most of us worked on the conference yesterday till 3:30 a.m. and we were back at it today early morning. Seeing a group of young professionals and students cooperating with others to advocate for change, for a better future is truly inspiring. To say that, at least, you can see the passion and the resistance to create and bring change in our work and advocacy. Despite the trauma some of our team has endured and continues to struggle as members with lived experiences and mental health challenges, we continue to have hope and work tirelessly till we achieve and change we hope for. So I was born in Canada, but moved back to Syria as a child. I came back in 2017 to Canada. I personally struggled a lot with loneliness, feeling disconnected and struggling with my own trauma and some depression. I started ABRAR as an organization to connect with others and help others who are at the same boat. However, I never did expect to find team members who later became just my second family. And I truly felt it last night. Like we were texting to each other and saying, please make sure that you get enough sleep. And it's so touching. Like I have no words to express how I feel about my team and the family that we've became throughout this year. The Is Together team brought together young youth from more than one community, and our team is diverse, and each member of our team bring a different background, different experience. Yet we all came together to have our voices amplified and heard. Most importantly, I'm proud to celebrate the family that we created together, the community that we belong to. This community is dedicated to advocating for those who don't have platform to speak up. Youth who look like us and they might not have the privilege to be here today. or to be in a leadership position yet. Therefore, we will be moving forward with our In This Together team, created by youth, for youth, to lead mental health projects and keep advocating and promoting accessibility, and along with our other project and services at the organization. And we look forward to that change, the unique change that we will bring to the table, because we bring unique and different experience. I don't want to be that long. I cannot express, because I have no words enough to express how honored and lucky I feel that I'm part of such a great team. And I look forward to the future. And that what made me like that, what I felt and realized how far we came yesterday. Since last year, we really grew a lot by lifting each other's. So I want to now show you that the team that behind the scenes. So we have, can we share screen? I want to acknowledge the team and make sure that they are shared. So yes, we have so and along our original team, we have after that the In This Together community leaders who were joining from other equity groups, and we will be moving forward with our In This Together advocate team. And yes, now without further ado, I want to acknowledge and appreciate the presence of Stephanie Arbiz, representing public health, and welcome our minister. We also have had the privilege to having the Honorable Carolyn Bennett with us today, a former family physician who now serves as the very first Minister of Mental Health and Addiction in Canada. We're so happy that the position has been created, and our minister will be the first. She actively advocates for health, the environment, women's involvement in politics, and disabled people. Minister Bennett's work shows her dedication to including Canadians in the democratic process. She turns to community members and people with lived experience to shape public policy and ensure public health measures indeed include the public. Thank you so much, Minister, for joining us today. We are greatly honored to have you. And yeah, on to you, please. Oh, yes, the host, please unmute the minister. I'm sorry.
There you go. There we go.
Yeah, just to ensure that we don't run into any. Thank you so much for joining us. And please, take it from there.
Perfect. Good afternoon, and thank you, Noor and ABRAR, for the beautiful land acknowledgements. And I'm pleased to connect with all of you from the various territories and communities that you are joining from today. Je me joins à vous aujourd'hui des territoires traditionnels des Mississaugas de Credit, où nous honorons tous les peuples autochtones qui ont pagayé ces eaux et dans les mocassins ont parcouru ces terres. As you've said, as the first Canadian minister, federal minister for mental health and addictions, and the associate minister of health, it is so great to be with you at this national conference to discuss youth mental health recovery beyond COVID-19 and on Bell Let's Talk Day. So I want to thank ABRAR Trauma Mental Health Services and your amazing team for organizing the In This Together campaign, and of course this conference Together Towards Recovery. Your passion is contagious, and I applaud you on all of the important work that you are doing and can continue to do for your community and inspire young people across Canada. I look forward to reviewing the findings and then working together to achieve measurable outcomes in mental health for youth. As you know, and as you started up, that these past 2 years have been extremely difficult for most Canadians. Omicron has now inflicted another blow, and we need all Canadians to respond by getting vaccinated and following their local public health advice. For 2 years, we've now had to respond to the unprecedented social disruption, the loss of loved ones, the concern for the well-being of friends and family, and as you said, ABRAR, loneliness. Les Canadiens rapportent une hausse de sentiments de stress, tristesse et de solitude. La moitié des Canadiens rapportent que leur santé mentale s'est détériorée depuis le début de la pandémie de la COVID-19. It seems that the unprecedented challenge of, of COVID-19 may have made it a little bit easier for Canadians to admit that they're struggling. It may be that this recognition will help to reduce the stigma and make it easier for people to seek help. In 1956, the first Director General of the WHO, who was a Canadian veteran, made it clear that there can be no health without mental health. Mental health is health. Et je suis aussi aujourd'hui parce que je veux que vous sachiez que vous avez un partenaire indéfectible au sein du gouvernement. Nous savons que nous devons appuyer les besoins en santé mentale de tous les Canadiens, maintenant plus que jamais, alors que nous nous dirigeons vers la reprise post-pandémie. We also know that this can't be done top down. We will need your help as we build an evidence-informed, trauma-informed, culturally safe mental health and addiction strategy. So young people, as you have identified, especially members of Indigenous, BIPOC, newcomer, persons with disabilities, and the 2S LGBTQIA+ communities have always been underserved and were amongst the hardest hit when the pandemic struck. In addition to quarantining and physical distancing, young people have had to cope with loneliness and isolation, brought only by the changes to routines in school and university closures. Many of you have faced economic challenges, and others have lost jobs, and many more are struggling to find part-time or full-time employment. Ensemble, ces expériences ont laissé plusieurs incapables de connecter avec des anciens pairs, amis et familles qui offraient normalement une source considérable de soutien. Avec l'absence de système de soutien habituel, certains enfants et jeunes font face à un risque accru de violence domestique ou d'abus à la maison et en ligne. All these stressful experiences have taken a serious toll on the mental health of all young people, including an increase in anxiety, depression, and loneliness, but have been even more disproportionately affected, as you've identified, for the BIPOC Canadians, 2S LGBTQI+, or those already facing significant challenges and living in difficult socioeconomic conditions. You have recognized the importance of ensuring that young people have access to mental health and substance use supports when and where they need them. And as you say, the fact that you're designing it with youth, by youth, that this is imperative in actually being successful. So as we all work on a recovery plan that improves the lives of all people in Canada, we are working with those who have expertise as well as lived and living experience to do things differently and to make effective mental health care more readily available and respond to the evolving needs and concerns of young people. Les jeunes et tous les Canadiens méritent d'accéder aux soins les plus appropriés à l'endroit le plus approprié par le fournisseur le plus approprié. So what we keep saying, it's got to be the right care at the right time in the right place, including virtual, by the right person. And this means looking at innovative ways of delivering services, such as the virtual supports for young people who've been unable to access in-person services, as well as tailored approaches to address the needs of vulnerable youth groups and ensure service providers represent the populations they serve. Integrated youth services models of care are evolving and provide affordable, locally relevant, youth-focused, and integrated services for mental health, substance use within your communities. These hubs are easily accessible, community-based one-stop shops that provide an integrated suite of services, which can include peer support, mental health and primary care support, employment counseling, as well as support for navigating these systems of care into a person's 20s. There's also the Mental Health of Black Canadians Fund, which supports culturally focused approaches and projects for improving mental health and its determinants for Black Canadians. Similarly, the Health Promotion Innovation Fund has been investing in community-based projects to promote positive mental health for diverse children and youth, including the 2S LGBTQIA+, Indigenous and newcomer populations, as well as their caregivers and those with disabilities. En plus de support accru pour la santé mentale que nous avons fourni aux provinces et territoires dans des accords bilatéraux depuis 2019, reconnaissant l'impact immédiat que la pandémie a eu sur la santé mentale des gens, notre gouvernement a lancé le portail Espace Mieux-être en avril 2020. As the only nationally available platform of its kind, the portal provides immediate 24/7 access to a range of supports available in both official languages and in many others. And if you haven't seen it already, I encourage you to check it out. Let us know what you think, in that we know that we've got to do better with the diverse populations, and we really do need your feedback. So just this month, we also launched Pocket Well, the companion app to Wellness Together Canada portal. And through the portal and the app, children and youth have free 24/7 access to mental health and substance use resources, including Kids Help Phone, one of your sponsors, which provides the online phone and text-based support to young people who are in crisis or dealing with mental health issues. Mon mandat inclut également un engagement à fournir un appui à une panoplie de soutien en santé mentale dont les étudiants d'institutions postsecondaires ont besoin. Cela va améliorer le temps d'attente et augmenter l'accès aux services en santé mentale sur les campus, incluant du support dédié pour les institutions postsecondaires autochtones. These are important steps in the right direction, but it's clear that much more needs to be done. People are looking to our government and to the leaders at this conference for solutions and supports. I've been given a clear mandate to set out national standards for mental health, which incorporates evidence-based solutions and the best practices, such as the stepped care model and integrated youth services. Nous devons continuer à travailler avec des organisations comme ABRAR et d'autres pour nous assurer que personne ne soit laissé derrière alors que nous nous efforçons de faire de la santé mentale quelque chose d'aussi important que la santé physique. As Minister of Mental Health and Addictions, I truly believe that engaging with and listening to diverse youth from across Canada is crucial. I look forward to working with you, youth groups, and partners across the country to support your mental health and well-being, both during the pandemic and well after. As a daughter, mother, daughter-in-law, friend, family doctor, I know how devastating mental health issues can be to patients and their families. I also know how important it is to reach out to people and meet them where they are. Young people, the 2S LGBTQI+ community, and people from marginalized communities have not been well served. People are suffering. We can no longer expect Canadians to adapt to systems that are not working for them. The systems have to change to meet the needs of Canadians. Ensemble, nous allons passer à travers cette période difficile et bâtir un meilleur futur pour tous les Canadiens. Nous avons besoin que tous les Canadiens sont que c'est OK de demander de l'aide. Et il est aussi impératif que tous se sont confortables de contacter ceux dans nos vies qui pourraient souffrir en ce moment. It's important that they know that we're there for them, and that we also suggest that they see their family doctor or nurse practitioner, at least start by exploring the Wellness Together portal, where they can get free support 24/7. Encore une fois, merci de m'avoir donné l'opportunité de prendre la parole cet après-midi et d'apprendre de vous. Mes voeux pour la conférence d'aujourd'hui. Continuons à la discussion aujourd'hui et tous les jours. Together towards recovery. Thank you. Merci, Miigwech.
Thank you so much, Minister, for such an inspiring, and like, we're so honored and really feel heartwarmed by you agreeing with, like, and we really look forward for your policy, and especially like bringing and co-creating that with you, like us and others. Thank you so much for such an inspiring speech, and we will do it together and together towards recovery. Thank you so much, Minister. It was such an honor having you here, and on to you, Noor. Please take it from here.
Once again, a very big thank you to Minister Carolyn Bennett. Thank you so much for joining us, and I hope this conference proves to be an inspiring event. So one of the reasons in this Together campaign is so important is because we're here to create conversations and, more importantly, create change. The COVID-19 pandemic has had a damaging impact on the mental health of youth all across the country, an effect that has left a mark on everyone. This research conducted by our research team has demonstrated this impact. Our research team, consisting of Rabia Ahmed, Amani Hanafe, the research leaders, alongside Madison McConnell and Zainab Gill, have worked tirelessly conducting, organizing, analyzing data to produce the upcoming presentation based on their work. So Rabia is a research leader. She has graduated from the University of Toronto with an honors Bachelor of Science in Mental Health and Biology. She's currently completing her master's in Health Informatics at the University of Toronto. Amani, our other research leader, has graduated from the University of Ottawa with a BA in Psychology and Health Studies. She's currently a graduate student studying behavioral sciences, and she's a former policy analyst with the Public Health Agency of Canada. Zainab Gill is currently a Bachelor of Health Science program student at McMaster. She's passionate about research in the public health sector and looks to spread awareness for underprivileged demographics in her community. In the future, she would like to delve into the healthcare sector, become a strong mental health advocate. And Madison McConnell is a graduate from honors psychology at the University of Windsor with the ultimate goal to become a clinical neuropsychologist one day. It is my privilege to introduce Rabia, Amani, Madison, and Zainab to present their results.
Wonderful. Thank you so much, Noor, for that lovely introduction. And thank you, Dr. Bennett, that your keynote inspired me a lot. And honestly, I felt really reassured knowing the things that you are working towards and how closely they resonate with the themes that we found and many of the challenges that keep reoccurring and that we identify in our personal and professional lives. So without further ado, I'll delve right into our research. So we began our research phase in February of 2021 with a review of existing literature on the effects of the pandemic on youth mental health, and in particular, youth from underserved communities. The purpose of our study was to understand the impact of the COVID-19 pandemic on the mental health and well-being of marginalized youth, and to understand the barriers youth faced in accessing mental health services. In order to do this, we designed a survey in consultation with the youth-led advocate team from underserved communities across Canada. Our youth advocate team highlighted multiple barriers faced by marginalized youth and their family members. We therefore designed custom questions with open-ended, multiple choice, and Likert scale questions to reflect the youth experience during COVID-19. We used open-ended questions as well as brief COPE-B and COPE-B scale questions to measure coping styles. Each person had the option to leave answers blank if they felt they were not comfortable answering them. And each person was provided with informed consent prior to the start of the survey. So our cross-sectional survey consisted of 35 questions, which were divided into the following categories. One, we had personal information, which was basically collecting demographic information. So we asked, ethnicity, current occupation, age group, etc. Our second section were open-ended questions where everyone was permitted to write as much or as little as possible, which did prove some challenges in the analysis phase. But the purpose was that we got unfiltered feedback and recommendations from youth directly so that we could understand what are the unique needs and how they come together to inform, macro needs across Canada generally. We then had the self-assessment section where we just wanted to know how's everyone feeling currently, what are the sort of the main stressors in their life. And then leading from that was the coping challenges section where we wanted to see how is everyone coping with those stresses. What are you using to cope with those stressors? What services are available to you? And then related to that, the services that you are accessing, how effective are they? How easy is it for you to access those services? And suppose you did start, what encourages you to keep going, or what roadblocks do you have to have from continuing to access these resources?
So as noted, in the purpose of our research, there are several current gaps in the resources and services available to marginalized youth in Canada. Our goals are aimed at tackling a few recommendations suggested by our previous research when it comes to benefit of upstream early mental health interventions. So these goals are structured around supporting possible efficiencies in mental health care. So number one being learning more about heightened service gaps that continue to arise, especially during the COVID-19 pandemic. Two, promote accessibility of mental health care for marginalized youth. Three, highlight the importance of early intervention as a stepped care approach for mental health care during the pandemic. And four, lastly, to just create a multi-sector, multi-service post-pandemic mental health recovery plan for Canada that is inclusive to marginalized youth.
To begin, our statistical demographics presented a significant perception of marginalized youth by age and by ethnic origin. The majority of participants are between the ages of 20 to 24, as seen on the left side of your slide. And we also had a good representation from many diverse ethnic groups and marginalized populations as represented at the right of the slide.
We documented the occupation status of our survey participants, and these were the results. Most had full-time employment with a total of 57 participants. 52 had post-secondary only, 49 had high school, 49 had part-time employment, 37 had no occupation at all, 18 had both post-secondary school and part-time employment, 11 had combined in-person and online employment, and 9 had post-secondary school with full-time employment.
The following sort of just shows the results of our quantitative and categorical section of our survey. And the overwhelming response we received was that youth were feeling fatigue, isolation, and loneliness. Majority of our participants reported having trouble sleeping, low energy, and loss of appetite, unhealthy eating habits since the start of the pandemic. Now, this is a concerning finding, as all of these symptoms and feelings lead to poor mental health, which can lead to the development of mental health disorders downstream if left unmanaged. And now, Amani, please.
So there was an array of responses received from our qualitative analysis. So we've gone ahead and categorized them into main themes to describe that analysis particularly. So I'm going to begin with inaccessibility. So many of our respondents expressed difficulty when seeking care, especially when they needed it the most. So some factors that could be deterring help-seeking behavior were long wait times, particularly. So just to elaborate on that, just in Ontario alone, about 28,000 children and youth are on wait lists currently to receive mental health services. And it takes them almost about 2.5 years to be contacted by practitioners and start treatment. So this number does not include the 200,000 marginalized children and youth who are half as likely to be put on wait lists or receive any form of contact or mental health support. Additionally, finding long-term care was proven to be a challenge. Early intervention is critical for effective long-term treatment, and lack of treatment access and the need for early intervention creates a sort of vicious cycle for patients. They cannot access the treatment needed for better outcomes, and this lack of access actually can worsen their symptoms. And a last final point that was just mentioned there is that youth have been expressing, the extra burden of exclusion on the basis of discrimination. So additionally, financial barriers was an extremely common theme underlying the responses in our research. 99 participants shared that financial barriers were some of the strongest deterrents to seeking and using mental health services. So youth expressed that mental health care was either too expensive or, when provided free of charge, inadequate or discontinuous. Since many youth are not yet financially independent or are in financial precarious situations, they're unable sometimes to access the care they are more likely to need during the current COVID-19 pandemic. Furthermore, wait times are even more greater for subsidized services, which are often overwhelmed with intake appointments. Youth have been placed in positions to wait while struggling with other issues or constraints. So a few of those constraints sometimes are actually posed by government health or other types of insurance plans. So for context, private organizations offer the most continuous care for clients. However, they are not covered by the government-funded health insurances in several provinces, meaning that Canadians must pay out of pocket for these services. And lastly, academic institutions that provide insurance are still limited in the amount of coverage allotted per student, which usually caps at $500. A respondent did share and express that the dread of having to see a new therapist and reopening the trauma with a new therapist once that free sessions are over or the expensive cost of having your own long-term therapist was continuously posing a challenge for them when accessing these health needs.
One of our other key themes is ineffective treatment. 67 participants felt that they had received ineffective treatment, meaning the care they received is not effective or only effective short term. This could be due to the fact that many services are too generic and do not cater to the specific needs of young people. Furthermore, there is fear of institutionalization stemming from and leading to harmful stereotypes. This is especially true in the case of racialized youth. Loss of control is a prominent issue in the mental health field, whereby clients do not have authority over their own care. Unfortunately, this has detrimental effects on the quality of care overall because clients are unable to actively participate in their treatment. And another element that leads to ineffective treatment is stigmatization. 61 participants shared that stigma and family resistance surrounding mental health acted as a deterrent to seeking or using mental health support services. In our study, one youth responded that they do not seek out mental health care because they felt that mental health care service providers were going to think they were crazy. Another participant said they had not sought attention because of the stigma that comes with it. In these challenging circumstances, our research supports an urgent need to push for the destigmatization of mental health so that struggling youth can access the support they need. Fear of being treated differently by friends, schoolmates, teachers, or colleagues prevents people from disclosing their accessibility needs to their school or workplace. Labeling theory refers to instances where a health diagnosis becomes integrated with one's identity, either by labeling oneself or being labeled by others as different. Labeling has negative implications of prejudice and low self-esteem, and it becomes a barrier to meaningful treatment. This implication is especially true for youth who are still developing their identity and for marginalized groups who are often already experiencing stereotyping in other aspects of their lives.
Now for a lack of cultural sensitivity. Understanding and sensitivity to one individual's culture, language, religion, and/or ethnicity is crucial to accessing quality mental health care. Previous negative experiences lacking these approaches serve to prevent individuals from seeking mental health care again. Particularly, 58 participants in our study shared the discomfort with a lack of cultural sensitivity within mental health services. Considering this, our research supports the drive for culturally appropriate and sensitive services used by providers to address diverse backgrounds, including minority groups and marginalized demographics. Stepping away from Western-centric narratives as a standard in clinical practices, one research participant shared a jarring example. of when there's a lack of cultural competency exhibited by the emergency services providers. They stated that I was detained and hospitalized for a psychotic break. The psychiatrist felt that my strict and controlling culture was the root of my feelings of fear and discomfort and tried to get me to leave my home. I found a private psychotherapist who understood my culture well and felt like my quality of care improved. As such, we can recognize the need for the push for cultural sensitivity as essential for improving mental health services. Just as cultural groups often are essential for providing a sense of solidarity, another vital aspect of community for youth is the academic environment. More than 90% of students felt isolated amidst the pandemic, prompting the demand of increased school support programs such as peer support. Furthermore, academic institutions, including schools and universities, have had to shift their program delivery and resources available to students onto a virtual setting with the pandemic and subsequent lockdowns. With these restrictions and altered virtual learning, many students have reported that the workload has increased, yet support from staff is largely inaccessible. Particularly, 28 participants shared that a lack of academic support worsened their mental health. One respondent shared that fully online students have been forgotten about by the school board and the government. They get crazy amounts of work and no support whatsoever. Academic institutions must make improvements in the aid and resources they provide, such as greater accommodations for student needs during the pandemic and further developed mental health curriculum.
Wonderful. So as our research has shown, there is a lot of need for more equitable services and more accessible services. So we came up with 4 key themes or 4 key recommendations that we hope to address towards service providers, stakeholders, and governmental officials when making policies and developing programs. So the first one of those is to increase the affordability and accessibility of services. So we encourage individuals to seek care, but this is quite futile if the barriers to seeking care remain in place. So a key step in decreasing the financial barriers of mental health support and services is making them available to use free of charge and in their proximity. While it is now a well-accepted fact that mental health is a critical component of an individual's overall health, this fact is not reflected in our healthcare system. Provincial healthcare plans still do not cover the costs of registered social workers, psychotherapists, or psychologists unless they work at a hospital or family health team. Now, if a person is seeking care at the hospital, they have already reached a mental health emergency. Therefore, many opportunities for early intervention are missed. Thus, a key recommendation is to provide universal health coverage for counseling, therapy, and other social support services for those that cannot afford it in their communities. So based on the feedback received from the youth participants in our survey, we proposed increased mental health counseling services. As many university and college institutions currently provide a limited number of free mental health sessions, commonly only 1 to 3 sessions, and even these are limited in duration, with some as short as 15 minutes. So increasing the minimum duration and number of sessions available for all students in academic institutions will require increasing the capacity of faculty and facilities dedicated to mental health, which can ultimately provide more quality care for all of the students. Next.
So increasing accessibility would also allow for our next recommendation, which is investing in early interventions. There's substantial research and literature to demonstrate a significant need for mental health services, particularly for adolescents and young adults. To limit the burden on already overextended mental health care infrastructures in Canada, we must invest in early interventions. Preparing for Canada's impending mental health and well-being crisis will require that general practitioners and family doctors engage in professional development so that they can correctly identify mental health concerns and discern appropriate next steps for youth seeking support. Moreover, in a climate of increased community mobilization and social innovation, our mental health systems need to be equally as dynamic and tailored to the needs of the people. Funds need to be consistently allocated towards counseling, peer support, and support groups for those with lived experiences, as well as long-term and trauma-informed psychosocial counseling services for adolescents and young adults. For youth, schools are sites that hold potential for effective early intervention. School personnel, such as guidance counselors and even teachers, need to be trained to appropriately respond to mental health crises in ways that recognize the youth's autonomy, as well as to assist youth in navigating stressful life events. Educational institutes should be safe spaces for growth and learning for all youth. If schools are hostile and promote discrimination through apathy or inattention, they function as a barrier to mental health and well-being. Thus, it is absolutely necessary that school systems are given appropriate financial support so trained mental health counselors can work on campuses and invest in early interventions.
Another key step is to invest in and contribute to the growth and development of culturally diverse services and providers. So simply investing more money into mental health services is not the only answer, since it doesn't directly improve the available services that currently. Rather, funding should be dedicated to grassroots, youth-led, and community-based mental health services. Local organizations that deliver indirect mental health support and promote the well-being of youth have a strong understanding of the needs of their community and what services would offer the most significant benefit. So an essential first step is to ensure the service providers represent the populations that they serve and are involved in leadership when making decisions regarding policies, treatment, and delivery of care plans. Having policy advisors and decision makers from underserved communities ensures their community needs are heard, which is crucial to providing adequate care. Youth themselves must also be consulted directly, for their perspectives would ensure proper allocation of funds and services. Therefore, we recommend that each province come up with a mental health youth advisory council, which participates in the decision-making process and directly affects policies and the delivery of care. Doing so will help Canadian government create inclusive and accessible mental health services for underserved youth. Stigma often stems from cultural or social misconceptions about mental illness. So our next goal is to reduce stigma through education and awareness. The creation and development of service models should occur only with consultation from diverse educators, parents, and community leaders who have lived experience or who have experience working with groups from these populations. And this will help to address and support common stigma-driven barriers that youth face. Our current clinical care models must also incorporate social justice to reduce the stigma surrounding seeking mental health services. We need to begin by reevaluating Eurocentric and male-centered models of care, and instead consider how unique cultural, racial, socioeconomic backgrounds can prevent youth from finding competent and adequate mental health care, or even seeking support in the first place. And in order to do this, our clinical models must be accessible for people who have not previously been represented in medical models in psychiatry. And this begins with the integration of alternative forms of therapy and care within mainstream service models. So for example, considering Indigenous ways of healing within our current medical models. So overall, to wrap it all up, ensuring access to equitable and effective mental health services is vital for the well-being of Canadian youth. Reevaluating the efficacy of traditional mental health and substance use service delivery methods is our way forward. Our results indicate that mental health care systems would benefit from adopting integrated and stepped care approaches to service delivery. Accordingly, creating effective mental health care system is not possible without first bolstering strong systems of social care and values of collectivity and collective responsibility in Canada. This requires funding and resources to be allocated to local agencies that respond to the needs of youth who face adverse outcomes due to socioeconomic deprivation. Interagency collaboration is required to create an adaptive and responsive continuum of care ranging from childhood to adulthood. Moving forward, we need to share funding models between federal and provincial governments to ensure equitable, accessible, and representative care. The following are just a list of resources that we found were quite helpful that currently exist. There's obviously more that we can share. Please let us know and we will share via email. And thank you so much to my research team and everyone else who was involved in this process. And a huge shout out to the 500 participants who shared their stories. I know sometimes in research, it just seems numbers and research, but these are the collection of a lot of people's personal experiences, which are not easy to keep reliving and explaining and expressing. So yeah, I'd like to acknowledge that fact that when we highlight these stories and highlight these themes, they come together from hundreds of people expressing distress and concern and worry about not being able to access support. So thank you so much for everyone, for all your support and for being here. And one final thing before we open ourselves up to questions from all of you, I wanted to put this question forward to everyone here. We've highlighted the gaps that exist. We've highlighted the recommendations as to how we think we can move forward. I'd like to hear from everyone that's here today. What's the biggest barrier you face in addressing these, perhaps care models or increasing services? What is preventing you from doing all of this? And perhaps you've already done a lot of these, steps, taking actions, and we'd like to hear of those as well. So if anybody would like to share, please do so.
So I think Shua can, yes, you can, please. You are unmuted, you can take it.
Hi, thank you so much for an amazing presentation, but more importantly for all of the amazing work that you're all doing. As ABRAR knows, the population that I work with primarily in a legal context are children and young people from the child welfare system. And I'm just wondering a bit about, within the research, within the recommendations, what your thoughts are about the unique service profile for that population, given the proliferation of ACEs, adverse childhood experiences, and also what we know statistically about movement from the child welfare system into youth homelessness, and the extent to which accessing mental health resources for that population can be a barrier.
Yeah, that's like a wonderful point. And we did make an effort to include that group in our research for that purpose, because we realized their needs are unique. And then perhaps, they experience things that other, just by saying youth in general, may not have those barriers. So in terms of our recommendations and what we came across in our research, realized the focus should be on continuums of care, right? We find that currently healthcare and mental health care specifically exists in silos of care, right? Everyone is focusing on, okay, yes, we're doing a great job because we have a lot of hotlines, right? But then all those steps before getting to a hotline, right? Which is why we stress so much on community-based support, right? And when we say community-based support, it's those organizations for youth in care, those organizations that help youth transition from care to just, being adults and then being in the community in general. So work with those organizations, understand those youth's needs, how they're specific to them, and how generalized care models will not be effective in caring for them. So really, yeah, that would be our main recommendations, which is why I think like consultation and co-design from the get-go when designing these models and services is so important.
I think that's such a thoughtful response. Thank you for that. And I think you're very right about the need for community level initiatives, and at a community level, the need for child welfare agencies to be integrated into community-based approaches. And I share your observation about the silos. I think they're an enormous barrier, and that perhaps the solution is, as you note, community and local initiatives.
Can you guys hear now?
Yeah.
Okay, so I would like to say the first is the cost, as you guys mentioned. There's been a lot of issue on like jobs. For example, like me, I wanted to go apply to a bunch of jobs, but the thing is like finding jobs has been more harder than it has been in the past, which has been a really huge problem. For example, some of my friends who are in need of therapy, but the problem is that they cannot find a job because they were originally fired from the job that they had before. So they tried going for therapy and every stuff. And they also try reaching out for school, but there's been another problem with the school is the school board failed to help students who is in need of mental health, because when you're asking for help from the school, they really won't show any care. They would just go right into the point and say, what do you need? Like they don't make the student feel comfortable or anything. So it's been a huge issue, especially for people who's in high school. They feel doing like assignments and all that. So as you like ask for the school board to like do a homework and all that, they really don't want to help you. It makes you feel guilt that they make you feel guilt that you feel like you're bothering them in the middle of their work. So it's been a really hard issue, especially for me. I tried to reach out for a school, but when I actually like met up with them, they really did not help. They were just saying, oh, just take your time, but they didn't really like actually say, oh, with all the steps that they need to help the mental person. Because like I've had struggled with like anxiety and everything, so when talking in class, it really makes it hard for me to really participate in class. So that's the second one. Another one is the government. So when you want to speak out to the government would not help. They would not listen to what you want to hear. They will listen to something that they want to hear. So when you say, oh, the government is not really like helping or anything, they really don't want to hear that. They will just completely ignore. But when they say, oh, the government is completely helping and everything, that they would listen to that. So it's a really huge issue on the government not really supporting on the mental health and everything. Yeah.
Thank you so much for sharing that, Estra. I first of all, I'm sorry about all the trouble you had in, accessing care, and please reach out to us, send us an email, and also we will email you a quick list of resources and the services also provided at ABRAR themselves. Number two, you brought up some really good points in terms of having difficulty accessing care, especially in high schools, because I feel like that's a bit of a gray area where in university there is counseling services, and then there's student plans and healthcare plans may cover at least some services. High schools is very much a dependence on the existing counselors and social workers. And the problem that exists there, and why I think you may have felt brushed aside, is when you have one counselor or one social worker for like a school of 500, they just don't have the human capacity to connect, to address issue. And that's, I think, where we need to look at, providing more resources and providing more personnel who are trained in mental health services. And that comes back to the early intervention model, right? Let's not wait until mental health becomes an emergency. Start at the level where people are seeking care, which is in their schools, in their communities, in public schools, high schools, and universities.
I was actually going to share my own story about that. I was in the hospital myself in sort of like a crisis situation. This was back in August, and there were no counselors at the hospital. You could speak to a social worker like once a week. And then they set up resources for me to have when I left the hospital, but it was a 5-month wait list to meet with CMHA. So it was 5 months of me recovering from a crisis situation, and I didn't have anything. I only had a counselor, but this was a counselor that I had to pay for out of pocket because I didn't have insurance, and it cost like over $100 per session. And luckily I had a nice therapist who, because I was going through a hard time, reduced the rate for me, but not everyone does that. So, you know, we have people coming out of crisis situations and they have to wait like 4 or 5 months for resources. And we don't even have counselors in the hospitals. So the lack of resources, like when I was going through the research, I was like, this is really matching up with my own life. Like it's very true that there's a big lack of resources and lack of knowledge.
Yes, hi guys. My name is Andrea, and I'm the president of a newly formed nonprofit organization. And I actually just stumbled upon this event that you guys are having. I was, just doing research, and I'm like, oh my gosh, because I'm sitting here and I'm listening to all the things that I've come across. So we formed our organization last year. So we're newly formed, and it's specifically geared towards minority youth, and mental health is the primary focus of it, one of the primary focuses of it. And that's because in the communities that I live and work, I've seen it firsthand in like East Scarborough, where we are. And I was recently filling out a grant, and this was what you're talking about was actually what I was putting in the grant, because, and as I heard Madison, I think that was Madison talking about her experience, I see that tenfold for minority youth. So the lack of resources, and then the lack of resources for minority youth. And so so that's a huge area. I found that minority youth, when they do get therapists, they don't get therapists that they can relate to. And so they'll probably have a couple of sessions and then they don't want to have anymore. I've actually had that experience with some of the youth. And so I'm actually happy to see that there's a minister, and, we hope with this that there will be, these needs will be addressed. And, the research that you has done is absolutely amazing. I just applaud you guys for doing it. And, I'm hoping that there will be some sort of breakthrough with this, because the mental health, and we're going to see the effects of this pandemic on mental health. We're going to see it for years to come, and so this is one of the reasons why we jumped in. And I'm glad that you talked about the grassroots organizations, because we're at the the level where we're seeing it in the communities, and I'm really hoping that there will be, the resources will be made available, but not just that, the available, the resources that are needed. And I'm mainly talking about, minority youth of color, BIPOC youth as well. So I truly appreciate this, and I'm hoping that, I can connect with you further. Just like I said, we ourselves are doing research, and so this was wonderful that we were able to hear what you've researched and found. So thank you.
Thank you so much for sharing that. I'm so glad you found it helpful. And yes, 100%. So happy we're moving in the right direction. And I was ecstatic when I heard that we were getting a Minister of Mental Health, because that's a step forward and a huge one. So very happy about that as well.
Mm-hmm, mm-hmm.
And then somebody, sorry, is in the chat wanted to go next? Or are we good? So it is 3:12 and we are a little over time. So I'm going to ask our tech team to move on to the next section.
Sorry, I don't know if you can hear me all right. I just wanted to say thank you to everyone who put this together. It's really incredible to see the work and the research that has gone on into this, especially for minority and racialized people as well. So I just want to say a huge thank you, and I'm hopeful that the government and all those in the policy world will take note of what you guys are doing and have meaningful implementation. And I just want to say thank you, and I applaud what you do. It's not easy to do this. I was in the same boat as you guys earlier on in the pandemic, and I'm just happy to see that there's more people on board.
Thank you so much. Appreciate it so much. All right, Fatima, you think you needed to move on to the next section. Is that what you were saying? Yes. So Noor is going to introduce our next speaker. Noor, please take it away.
Perfect. So thank you one more time for the presentation and the passion and dedication from our research team, but not only from our research team, but from our participants, the attendees asking questions and in the chat. It's very, very reassuring. Now, I'm sure our next guest is no stranger to your screens. I myself am really looking forward to this first presentation. We have Bruce Kang, also known as Falafel Kimchi. He has quickly gained popularity online with his viral videos where he shocks audiences across the globe with his fluent Arabic and funny videos. And even though he wasn't the biggest fan of my behind the scenes, behind the screen joke at first, I'm very happy to introduce Falafel Kimchi. Take it away.
Woohoo! Is my screen open? Can you see me, guys? Oh. Hello. Oh, hey everybody. How's it going? How y'all doing? Yeah, okay. Put it in the chat below. How are you feeling today? Sad, happy, depressed? Be honest. Let's go. Good, excited, cold, great. So tired, energized. Okay, let's go. To be honest, I don't know why I'm doing benediction. That being said, I have a joke. No, I'm joking. Okay, so yeah, today we're going to be talking about advanced math functions. I'm joking. So a little bit intro to myself. My name is Bruce, aka Falafel Kimchi. I am South Korean. Squid Game. I studied Arabic about 2.5 years. Muslim 13 years ago. And then it's the beginning of the pandemic. It's funny because I started Falafel Kimchi making stupid TikToks. And here I am today talking about you guys, or talking about mental health and addictions. But yeah, currently I just do social media management for businesses and content creation. So let's get right into it. When I was in West Africa, Morocco and Mauritania to be exact, okay? It's a very interesting story. People, you're just gonna love this. People, when I was walking around through the market, can't fathom the idea. People thought that I was Chinese. They're like, oh my God, are you serious? Yeah. So I was walking around, and from top to bottom, old and young would jump up and down, yell to the top of their lungs, Chinese, China! And I'm not, no cap. And why am I telling this? I don't know why, but I'm telling you this. I learned how to accept that everywhere you go, there's gonna be racism. But to be honest, I am not that prepared for this. I wanted to talk about like just where how did I overcome some of my mental health and issues, because this is kind of serious. And oh shit, I'm lagging. I switched. Are we good? We good? We good?
Yeah, we're
Am I
good.
good? Sorry about that.
Your
Sorry about
camera isn't on though. I don't know if you know that.
that. No, what?
There
We
you
can't
go.
see you.
Perfect.
We're good now?
Yep.
Okay. So I don't know where it cut off, but I wanted to not only just like, instead of just me telling jokes or whatever, I wanted to go through like maybe a little bit of my lifestyle and how I overcame some of the things that were very that affected me mentally. Like for example, living in West Africa was a big change. I mean, like you're foreign land. You don't speak the language, and it can be, there was a lot of things that that I had to get over, right? So one of the things that helped me as an individual or just moving forward with this pandemic is just, for example, learning a new language or doing something productive. That was one of the things that I relearned in West Africa, but then I continued on with the studies. So that was one thing that it helped me to get through this pandemic. And honestly, I think everybody is just tired of this Omicron, Megatron, Decepticon, all this stuff. We just want to get back to normal. But what we can do now is just be somewhat productive, do something. I know that everybody is like, it's very daunting, you know, just to hear all the news and there's a new strain and this and this and this. It's just, I would say maybe stop consuming negative content, start doing productive things. And I know it's easier said than done, but I can assure you that it will help. So going through this, I prepared some tips that would help me, or that help me and that can help you. Number one, mindset. So have a can-do attitude. Throughout whatever happens through this pandemic and through this, whatever's going to happen, hopefully no wars or anything like this, is that have a can-do attitude that you can and you will overcome whatever happens in your life. Life is hard. It's very, very tough. Nobody says it's going to be easy, and there's no promises, no guarantees. So if you have a strong mindset, you can overcome almost everything and anything that happens. Number two, love yourself. Learn to love yourself. I mean, this was one thing that I had challenges over, because being from a weird mix of like Korean, Canadian, speaks Arabic, I didn't understand where I fit in with the minority or group. And I fit in with the Muslims, but it was just like kind of like I was like an odd one out. So I learned how to accept who I am and know who I am, and not let other people dictate who I am, and have love for myself of just being me. Another thing I recommend is like physically, like don't walk around and slouch and like weak, like kind of like put yourself back, shoulders back, do like, for example, a victory pose. When I was traveling and I was going through the airport recently, I looked like an insane person because I had my bags on, and I would literally just walk and just do this. I have my bags on. It just makes you feel physically like you cannot be sad and depressed if you're doing a victory pose. And then the last thing is get out of your comfort zone. Do something different. Go to the gym. Stop, procrastinating. Go for a walk. Just get out of your comfort zone, because comfort kills. And also, I just had like some questions. if that's all right to ask. Yeah, okay, all right. So I think it's okay to ask, okay. For an example, what are some of the things that you see? What are some of the things that you'd like to see? Because everybody's on social media, everybody's on their phones. What are some of the things that you like to see in an app that you don't see? So the question was, what are some things that you like to see in an app? Mind you're spending too much time. Okay, awesome. Yeah. So what are some things that you like to see in an app that you don't see normally? Or what are some of the things that you don't like about social media apps? Okay, let's go. Let's go to the chat. Filters. Can repeat auto alert social support network. All right. Reminded you're spending too much time on social media. That's a good one. Filters. Too much comparison. More realistic feelings on mental health. Bad news on Twitter. Social comparison. Too many ads, interfaces are too different and needlessly complex at times. The ego of influencers. Ooh, that's me. More easily accessible links to resources, less use of filters, negativity, inspiration, quotes, reminders, etc. Because cause you to be less productive, waste hours just scrolling. That everyone's trying to pretend that they're living a perfect life and let the viewers feel bad about their lives. That is a good one. Influencers saying being skinny is like being the best in the world. False influencers, only seeing people's best rather than realistic styles. So a lot of common thing. Oh shoot.
I'm so sorry. I hate to interrupt because I'm seeing a lot of things I'm relating to, filters, spending too much time on social media. I know personally I'm on TikTok way too much because videos don't end. But that is the end of our time. But I want to say thank you so much for being here today, and everything you really said really resonated. I'm taking note of those recommendations and the advice, the stories. Thank you so much.
Peace.
Bye. So now, up next, we have our youth panel, which is being led by my good friend Shafia Ahmed. So I could brag about her for hours and hours, but she would be so embarrassed. So instead, I'll let Shafia introduce our inspiring youth panelists. Take it away, Shafia.
Thank you for that lovely introduction, Noor. I feel so flattered. My heart is warm. I could talk for hours as well about Noor, but I'm just going to get straight into it and introduce our panelists for today. So we have Connor. Connor is from Doki's First Nation. He's in his third year at Nipissing University, and he's doing a double major in Indigenous Studies and Gender Equality and Social Justice with a minor in Legal Studies. He sounds like he has a really full plate. He's situated on the Robinson Huron Treaty Territory of 1850. Next, we have Amira. Amira is the founder and president of Youth Guide, a mentorship nonprofit organization. She's part of the 2022 Top 30 Under 30 Award in Alberta. It's incredibly prestigious. I'm so glad to be able to talk to her. She is completing a degree in psychology at the University of Alberta. We have Aditya. Aditya is a first-year student at Western University. He's been actively involved in youth engagement networks with the New Mentality in Children's Mental Health Ontario since 2018. That's incredibly impressive. I wish I started that young. Easy is from Gatineau, Quebec. Easy is a Jack Talks speaker at jack.org. He's completed a bachelor's in international development, globalization, and communication at the University of Ottawa. And finally, we have Mawahib. Mawahib is a second-year honors political science student at Concordia University in Montreal. She is the We Want coordinator at the Students' Commission of Canada, who is a partner at ABRAR Trauma and Mental Health Services. I am so glad to have this opportunity to talk to these incredible leaders. They have made such huge differences in their own communities, and they've really worked to make their own lives and the lives of those around them better. So without further ado, I think I'm going to just get straight into the questions. The first question I have for everybody is, I just want to get a better sense of what you believe are the key barriers that create healthcare in our healthcare systems that create barriers to accessible mental health services for marginalized youth. And I know that we discussed this in our research report, but I think that through your personal and professional experience, you might have some really interesting insights. All right, I'm just going to go in the order of everybody who I see on the screen. Connor, would you like to go ahead and answer first?
Yeah, thank you. I think there are many barriers that impede our youth and really any marginalized person in Ontario and Canada. Really, there are significant barriers when it comes to visibility. So not being able to see yourself within healthcare, and not being able to have people that are accessible that understand your intersectionalities, whether that be on a race basis, gender basis, anything when two things intersect, it can be very difficult to even understand and to know where you can get healthcare. I know for Indigenous related issues, it's hard to get things that understand the historical context of Indigenous people in healthcare, understand the different barriers that occur to accessing care, whether you're on reserve, off reserve, and different things that have to do with that. Gender care and people who are within the LGBT community have a hard time accessing accessible people that really understand them and do not feel judged by them. So I think there are many barriers that we don't consider when we think about healthcare that really just stack up when it comes to access, to physical access. I know for my community, it is an hour and a half minimum to get to the nearest hospital. And it is even further that to access greater care. Even just getting ambulances and things out to our First Nation on the dirt road is very inaccessible. And so there are many things that impede our youth from even just accessing these in the first place. And then once they get into the door, there are other challenges that kind of surface there as well. So that's where I'll leave out my answer, but thank you.
Sorry about that. I'm having some trouble unmuting and muting. I would absolutely agree. When we talk about mental health and mental health care, it's often in this sort of with this like super hyper focus on cities and urban communities that don't really consider the barriers that people from rural communities face, in particular Indigenous communities. I think that's an incredible insight. I mean, also go in the order of this who I see on the screen. I think that's you, Amira.
So I definitely will kind of piggyback off of what Connor was saying. Visibility is really, really important when you look at mental health professionals, what they understand, what they and how they express themselves to people accessing services. But I think for me, within the Muslim community specifically, looking at other social influences that affect people and affect whether or not families would be supportive of their kids getting mental health services. But in addition to that, so like that's one obstacle that a lot of youth in my community would have to overcome. Another part of it is accessibility for sure. And I think too, there is a lack of services for the transition periods that youth go through today. So like between middle school to high school to university, if you didn't have older siblings, you're kind of on your own. And I think that that's kind of the bulk of the work that I'm focused on, to help kind of bridge those gaps, because they're already really big transition periods and they're very difficult to overcome, in addition to any social concepts that an individual would be affected by on a like an individual basis. And I think I'm going to leave my answer there.
All right, thank you. I just got access to be unmuted again. I love how you mentioned people without older siblings are super out in the cold. I know personally my two sisters have helped me so much throughout my mental health journey. And I honestly would have been lost without them. So I don't want to imagine how isolating and how difficult it must be for somebody who's completely alone to sort of figure out the entire process of how to get help, how to build community in Canada. And next, Aditya, I believe you're next. I see you on the screen.
Thank you. So I think this is a very important question that we as advocates have to be constantly asking ourselves to ensure that the work that we're doing is striving to fight for the needs of the youth in the system that are accessing mental health resources and clinical help. And mental health care is incredibly difficult to access for the entire youth population. And then socioeconomic and sociocultural barriers in marginalized youth only increases these challenges. So I'm part of the Youth Action Committee, which is a part of the New Mentality and Children's Mental Health Ontario. And we recently developed a policy paper that we released today, which highlights the challenges faced by marginalized youth. And we found that the BIPOC youth face barriers from particularly racism, discrimination, cultural insensitivity, and cultural stigma that really prevent access to mental health services and create negative experiences upon usage. And this is a significant challenge that is often overlooked when governments increase access to mental health resources. So simply increasing awareness and visibility of these services is not enough. And the challenge is within these systems themselves. Often non-racialized service providers lack the understandings of traumas faced by BIPOC youth. In specific, things like intergenerational trauma is a big thing. And often training or anti-oppressive practice trainings aren't sufficient, and rather systems need more involvement of people with lived experiences and people who are able to connect with the youth. And not only does this improve the clinical care, but it also makes youth feel like they belong. It feels like it's a safe space. They have someone that they can relate with. And these are questions that governments also need to be asking. The youth organizations, for example, the New Mentality and many of the ones represented here on this panel, are doing a lot to advocate for these issues, but it's not efficient until the governments are able to implement these ideas and really connect with the organizations. And while this is just one of our findings, we also discovered the idea of economic disparities in BIPOC communities, and inadequate access to financial resources really prevented youth from accessing help. And though child and youth mental health supports are funded publicly through the government, a lot of the things such as transportation or access to technology are not. And this is a big issue that has increased the inequities in the pandemic, where a lot of youth from certain socioeconomic backgrounds don't have access to these resources, and that really limits the care that they can receive. And also in terms of transportation, rural communities, places in Northern Ontario, really are at a disadvantage when it comes to transportation to services.
That is an incredibly comprehensive response, and I'm so glad that you're taking the initiative to do research. And I would absolutely agree, just looking at the amount of youth initiatives that are out there, a lot of community mobilization that is happening is on the behalf of communities who feel that change needs to occur, and they're often the ones driving change. And I'm so glad to be here with everybody, a lot of 5 incredible youth change makers today. Mohab, do you have anything to add?
All right, I had to wait until I was unmuted. Yes, I do have things to add. A lot of you guys have mentioned a lot of points that I wanted to bring forward, and I'm really glad that we have similar concerns. And so to add on to what has been said previously on accessibility, the way I perceive accessibility is that there are layers to it. And so first of all, the fact that those mental health services are not accessible for marginalized youth because sometimes they're just not affordable. There's also the element of the fact that there isn't enough awareness being spread in communities about those services. And then there's the last layer that I relate to personally, but as a Somali woman, there's a lot of stigma in our community about mental health in general. And so all of those combined makes it really harder for marginalized youth and BIPOC youth to have access to services equally. And there's also the element of cultural competency and intersectionality that has been mentioned by Connor, and I think it is really important to reinforce. I think there needs to be a lot more work done in recognizing the role of systemic racism on our bad experiences that we have in the healthcare system and how it can negatively affect our perspective of certain mental health services. And so I think it's really important to also have advocates who are intersectional in their approach and their responses to make sure that we have better mental health outcomes.
Absolutely. I couldn't agree more. Last person to go would be Easy. I think we're just waiting for him to be unmuted. I'm gonna unmute and see if that works.
Feel like whenever you go last in a panel after so many inspiring people talk, like all you have to say is like probably repeat everything that was said. But if there's something that I can add, the fact that marginalized youth are lacking representation at some point is one of, like, in my opinion, one of the biggest barriers in the health system or outside of it, because like Omar just said, there's so much stigma around those communities when we talk about mental health that it's hard for them to be able to even go seek help. Because like one of you was mentioning in the research earlier on, we were talking, like one of the participants was talking about how she felt like she was crazy or she was perceived as crazy to go and seek help. And sometimes the stigma that comes into our communities is something that's really hard for us to go after, and it makes it hard for us to actually go seek the help that we actually need. So I feel like when we're able to have a better representation outside and inside of the health system, it's going to be way more easier for everybody to go get the help that they need. But we also need to think that we talk about the health system as like the hospitals or the clinics and stuff, but the health system can also be paired with, let's say, faith-based community. If you have access to counselors in faith communities that know how to talk to those different communities, you're able to widen your health system and make it bigger and have some better resources. Because right now we see there's a crisis in the way where people are trying to get the resources to get the help that they need. But if we're able to make those circle bigger by implementing allies, like I said, faith-based communities, like support communities, and people that are formed with the right tools to actually help, I think that we're going to be able to diminish the impediments that we have right now in the mental health system.
I don't think you need to worry about going last. That was incredible. I could spend some time and just go over how each one of you just kind of blew my mind with those responses. It really sounds like you spent so much time looking, like kind of going over them and thinking about them. But I do have to move on to the next question. And that is that, we've been talking about all of the issues that we've been seeing and experiencing with mental health systems in Canada. And I think it would be worthwhile to discuss, based on your personal or professional experience throughout COVID and in your work with youth mental health and well-being initiatives, are there any areas where you've seen actually meaningful change and positive change occur? We're going to just go in the same order. Connor, how about you?
Yeah, thank you. I've been working with a lot of youth-led projects lately during the year. As awful as this year has been for a multitude of reasons, I think it really allowed the space for a lot of youth-led movements to begin. I was part of a youth action group for life promotion, an Indigenous youth group across Turtle Island. I think we were about 10 youth, and we created a life promotion toolkit to really give a voice to those youth that were having a hard time, and really for communities and non-Indigenous folks as well. And I think that those spaces, that space that COVID allowed for folks to kind of take a breath and be at home, allowed for us to have those meetings and have those good conversations. It also allowed for for a different group and I to write a policy paper on Indigenous undergraduate situations, and to really, COVID really allowed us to pinpoint those different issues that people were really overlooking. And so it really spotlighted, like, well, why are BIPOC folks more affected by COVID, and why are these things only coming to light now? And it really just allowed for us to be like, this is the history and this is how it is affecting us now. And it really just allowed us to speak about it so clearly and so visually. I also found that a lot of people were stuck at home and had to find themselves educating themselves, whether that be through videos, through conversations with friends. I just found that there was like an uproar of folks that were, at least in my circles, trying to learn, whether that be with residential schools or with the history of just BIPOC folk in general. I think that people at least took the time to understand some of our issues and some of the realities that we face. I know that there were countless occasions this year where I was able to sit with non-Indigenous folks and have conversations, whether that be through a panel, through podcasts or things like that, where they just wanted to learn and they just wanted to understand. And it really, this year, created a time where folks really had to step up and to learn something, or else they were really left in the dust, because everybody was there. Everybody was at the movements. Everybody was talking about the grave sites. Everybody was really pushing for that change, at least for a little period of time. And I know it's not as much as we hoped, and we hope that it continues until the problem is resolved. But there was an uproar and there was a call to action that was really being followed this year. And I think that COVID really allowed that time for people to have to educate themselves, because they were sitting at home and seeing everybody else do it. And so although I hope that it doesn't continue and I hope that it doesn't happen again, I think that if anything, it allowed folks to sit with themselves and learn even more about themselves than they did the previous years.
Absolutely. It is so reassuring to see that COVID kind of created this environment where people were able to sort of harness digital tools and take technological innovation and make it work for them, and, kind of force conversations to happen. Because honestly speaking, in my personal experience, if you don't learn, if you don't continue learning throughout your life, you're going to get left behind. Those conversations that are so critical for change to occur, you just, unless, I don't know, I guess I've learned that if I don't open my mind and open my ears and actually listen to people when they speak, I simply won't have the ability to, you know, be involved in change making processes and kind of contribute to sustainable change to occur. Amira?
So I think for me, based on both my personal experience and just youth experience in general, I think mentorship is really valuable. So growing up in Alberta, wearing a hijab, being Muslim, it was very isolating, I think. And I struggled with my own mental health for a really long period of time. And I think that the only thing that ever supported me or helped me was finding spaces that allowed me to be who I am as authentically as I wanted to express myself. And so when the pandemic first started, I think I was kind of at a loss for how I could continue this work, especially because we couldn't see one another. And so I think that this is kind of how the Youth Guide stemmed from the pandemic. We started it as soon as the pandemic started, and we put together a resource and a curriculum to basically discuss all the things that matter to youth today that maybe they don't have a space to talk about them. And I really like the point that was mentioned earlier about finding faith-based spaces and including them in the mental health process, because it's so valuable for a lot of people, especially if that's how they identify. And so I think, based on my experience, COVID was really powerful in the sense that, yes, it was very physically isolating, but it wasn't socially isolating, in the sense that people still could connect with a mentor, at least through the Youth Guide and within the work that I've done. And they could talk one-on-one with the person who was a lot more aware of their situation, a lot more aware of the things that matter to them, and they could support them through that process. And I think that because of that, social media filtering has been a really big theme, at least in my community, of like being very conscious and very aware of what you see on social media, who are you listening to, how are you interacting with the content that you're seeing. And I think that that creates a huge wave of self-awareness. And I think, to Connor's earlier point, that's definitely been a theme here too, especially with the different social movements that kept coming up, at least in Alberta. And because of that, I think it makes people a lot more powerful in the sense that they aren't following the waves just kind of blindly, and they can think for themselves, and they can critically look at the things that they're seeing, whether it's on social media or now in person, and see if that aligns with their mental health, with the things that they believe in, and definitely keeping that a priority for them. And so I obviously don't wish for COVID to happen again, because I feel like we've had enough of that and it's gone on for a really long time. But I think it was very important to have that period of time to isolate yourself from other people, whether it was intentional or not, to kind of clear your mind and really be conscious of the things that you're absorbing and the people that you're seeing on a constant basis. But yeah, that's very much what I think.
Absolutely. In my own education, I'm learning how important it is to be able to reflect on yourself, what your position is in the world, and how you relate to others, and how you either contribute to sort of creating negative change for others, or creating barriers for others, versus how you can contribute to making the lives of others better. And I think it's absolutely important. I think it's incredible that you were able to create this incredible organization based on mentorship, and you're able to help others just like you. It's very heartwarming. Moab, do you want to go on next?
Yes, so thanks everyone for what you have said so far. Speaking from my experience at the Students' Commission of Canada, there's one main area of change that we have noticed during the pandemic, and is that we discovered a variety of ways to engage with youth. And so prior to the pandemic, opportunities were predominantly held in person. And I have noticed how online programming has enabled certain demographics to engage in events and workshops about mental health and well-being. And so, for example, like I know that some youth who participate in our activities are dealing with issues, health issues or disabilities, and really have appreciated the accessibility that online mental health activities and services provide. And so as some of us find it challenging sometimes to do everything online, I think we need to be conscious that this has been a positive experience for many others, and also enables them to access services that they might have not even considered if they were strictly in person. And it also creates a sense of safety. An advantage that we've noticed online is that when you feel discomfort, you can, for example, turn off your camera, mute yourself, or just ask to leave the situation that makes you uncomfortable. And I think that's a privilege that we've gained through online services rather than in person. And I think that's one that needs to be mentioned as well.
I think that's incredibly insightful. I'm going to move on to Easy and then Aditya, and then we can go on to our next question.
I feel like that was so well said. A lot of people see COVID, like, I know that it's not a positive situation and I hate it. Like, I'm an athlete. We used to, like, with everything that happened, it's really hard for us. But I feel like a lot of people learned so much about mental health, like their own mental health in general, because of the pandemic. And sometimes I see this situation as a pause moment where everything stopped and we had to take a moment to look at ourselves and be like, okay, this is what's wrong with what we're doing right now. And this is what's wrong with what we're doing right now. And this really, especially in my group of friends, and I'm talking about men's mental health, that's something I'm working a lot on. Being a guy, if I have to go in my background, being a guy and being into the sports world, you're often trapped in a place where you don't want to express your feelings or express the way you're feeling. And it often goes into sports. The way I would express myself would be through sports. So when we missed that, and like some of the guys, I was glad that I've been working with mental health for a long time, but some of the guys that never did that in the past didn't, like, they were like, oh my God, I can't play sports no more. So how do I let all the frustration, the sadness, or everything else that I have on my mind? And we started to actually sit down and see how we could find other resources. And like Moab just said, when you're online and you have resources, you can decide to either attend or leave when you don't feel comfortable. And I feel like for a lot of guys and for a lot of people in general, that made them actually search up and try to find the right resources for them. And I feel like we've seen a lot of negative from the pandemic, but on this thing, like right now, just the panel we're having right now, and we're talking about like issues and ideas that we have to like make the things better, you see that people are starting to be like, hey, mental health is as important as physical health, and we need to push that forward going forward, because that's where we're gonna be able to have a healthy society. We've been pushing physical health for so long, and it's important. It's still important. Like I said, I'm an athlete and I know how important it is, but you can't have physical health without mental health. It goes together. And I feel like that's what COVID, even if it's negative, that's what COVID brought back on the playing field, if I can say.
That was an incredible analogy, and I love how you were able to connect it to the importance of physical health and mental health. Those two things go together very, very strongly. Aditya, do you have anything to add?
Yeah, I think everyone's brought up really great points, especially I like the one Easy brought up about the idea of wellness as a whole, physical and mental. And there's more domains to physical, mental, spiritual. And I think we've all had a chance in this pandemic, as everyone's mentioned, to reflect on these aspects as we're, going through periods of social isolation, lockdowns, not being in universities, not being in schools. They've all given us a chance to reflect on these and also develop our own strategies and understand ourselves better. I think personally, I've understood how to, de-stress, how to find things that, keep me productive, maintain my schedule, maintain routines. And these are all things that I've adapted to over the pandemic. And this hasn't been easy from the beginning, but as we go, we're all learning and we're all able to share that with each other. And I think that's what a lot of organizations similar to what my organization we've done is we developed a e-learning course for mental health and addictions for youth in the region. And it was just coincidental that it became so useful during the pandemic where youth were able to access these resources on their own and also have a chance to access some self-help resources. And this is something that's often missing from the front stage. A lot of youth don't know about these resources, but I had the unique opportunity to speak with staff members at my school and share these resources. And something else is early on in the pandemic, I wrote a research paper about mental health challenges faced by students during the pandemic. And these particularly included things like social isolation, the lack of routines, and increased screen time during the pandemic. And further, I developed 5 strategies to support youth mental health, which included improving the resilience of high school students with certain self-help strategies. And this is very important because the psychological impact of COVID-19 will be felt in both the short term as we go through this pandemic and the long term beyond the pandemic. So building these resilience and strategies in youth is a very important point. Also looking at things at developing peer support networks through school clubs and other social clubs is also something that's very important. Leveraging digital technology for mental health support, looking at these types of e-resources that we're all developing, that we're all looking to share with each other. Even the different types of papers that are coming out from the ABRAR organization, from the New Mentality, and it's all to increase awareness and increase the awareness of these problems that have been highlighted during the pandemic. And also looking at different types of collaborative partnerships that can happen between health organizations, school boards, and actually, following the release of this paper, my virtual secondary school asked me to speak at the staff general meeting to talk about strategies where they can support their students. And I found that this was a very valuable collaborative partnership where the student voice was amplified and real changes were made in these virtual classrooms to support the mental health of students. And while I'm very proud of the changes that my district made in virtual classrooms, this decision should be really taken at a provincial and at a federal level, where these resources are distributed across the province, across the nation, to increase these mental health support programs in virtual schools and in schools in general. And adjustments to curricula should be made to adapt to virtual education. And I think that's a very big idea that we should all transition to. And looking at the role of digital equity and access to technology and how this all intersects with mental health and mental health care.
Absolutely. I think going forward, there's going to be huge conversations around how we can restructure our education system to fit the needs of new generations of kids and children coming forward, because a lot of our educational strategies to encourage children to learn and grow and develop are very outdated, and they fit very traditional models. And I'm very excited to see all of the new insights that are going to be coming. Sorry, I think I was unmuted. In our report, we discussed how a lack of cultural sensitivity and competence was an area of concern for youth receiving or seeking service provisions. And in your own lives, each of you works to investigate how social injustice, determinants of health, systems of oppression, historical context, all of these sort of structural barriers function to create significant hardships for marginalized youth, and particularly they work to create barriers to mental health access for marginalized youth. So when you consider all of these things as in sum, especially considering the strain that COVID-19 has placed on mental health care infrastructures as they exist right now, I would ask all of you what steps you think need to be taken to improve Canada's mental health care systems, and in particular, what kind of specific actions do you think need to be taken to create to develop cross-cultural practices and foster inclusion within these systems? That's a really big ask. So if you want to split it up into two and think of like how to foster inclusion versus what kind of flaws exist in the mental health care infrastructure as it exists, is totally okay. You can choose which question you want to answer.
All right, that is a large question. I do agree with Ezekiel that talking about the parts of ourself, like we're not just a physical, not just the mental, not just the physical, but both. And I even take it a step further when we look, when we think of the medicine wheel, we think of our emotional self, our spiritual self, our physical self, and our mental self. And that's really the four parts of ourselves that we need to keep in balance, at least the way that I look at myself and how I am. And I think that is something that holistic view needs to be incorporated everywhere, because without those balances, whether you're working out, twice a day for forever, if your mental health is lacking, your physical health is going to lack as well, because it's just the way the balance works. Maybe I'm just all for decolonizing every Western institution, whether that be political, educational, or medical, mental health and things like that. So I'm just all for the decolonization of all of those systems. So I think including those holistic ways, including spiritual healing, holistic healing, we don't just need to talk about prescribing things and doctors in that sense. All the times now when you go to the doctor, it's really just a prescription heavy appointment. You go in for 5 minutes and you go, here's your prescription, it'll make you better, next. And it's really not a patient care system. It's really just a easy way to get rid of the patient and numb the pain. And that system has been put in place since the war and things like that, where you numb the pain and then you go back to work, and it really feeds into that capitalist mindset. And so if we keep going that way, we're just going to keep numbing the pain until there's nothing to numb and we just won't be there. You know, we just keep suppressing. We need to focus on healing and caring rather than just numbing pain. And so for me, that really looks at talking to individuals about what they need from their care and not just focusing on, you know, because healthcare right now is focused on like that white, cisgendered, heteronormative person. And so if we focus all of our attention on that, we are missing, I would argue, most of the population. There is a very small percentage of the population that fits within those categories, and we are basing our entire medical education on that. And so to really broaden the sense of how we're looking at medication, how we're looking at healing and how we're looking at caring for patients, and not just leaving it to that such a simplest mindset of, I'm going to give you this pill and it's going to make you better. And if it doesn't make you better, then there's nothing I can do. You know, focus on therapy, and whether that's physical therapy, mental therapy, healing as a process instead of medicating would be such a more beneficial way, and would actually be cost effective, because we wouldn't be ranking up those pills. We would be healthier as a society because we could understand, as much as those pills make us better in one sense, they also have side effects. And so they're damaging another part of ourselves that we cannot compromise. And so I think if we focus on healing, if we focus on including when it comes to consultation, so like asking BIPOC communities, what do you need? Asking LGBT communities, what do you need? Asking different religious communities, what do you need to make your healthcare safe for you? What do you need to make your healthcare actually work for you? I think we're so focused on making healthcare work for everyone that it's working for no one. And so if we kind of flip that script and really listen to what people need, have that understanding, that compassion, have inclusion, I think that is what will really improve our care system.
Like goosebumps, literally goosebumps right now. Like I almost got emotional halfway through. That's incredible. Like I can't even put words. That's beautiful. Chef's kiss. I'm not even gonna. Wonderful. Amira, you're next.
I feel you. I'm like, it's so great. I don't know how to go after that, but I think you brought up really, really good points. I kind of want to add on to that in terms of cross-cultural practices. I feel like collaboration and community are something that constantly gets overlooked when talking about mental health services. We live in such like an individual focused society that we don't really look at the collective support that we can offer one another. And so part of even like establishing boundaries with other people is usually leaving and isolating yourself from other people. But I think that if we were to enrich and empower communities to help their own, we'd have a lot better results when it comes to healthcare. And so when it comes to the concept of allyship and looking at different marginalized communities to collaborate with one another to provide whether resources or ideas for how they each take care of their mental health would be really, really powerful. And I think that a lot of times, and I know this has been mentioned a few times, is that a holistic approach to mental health will include that you look at your physical health and your mental health and your spiritual health constantly being connected to one another. But when your physical health starts to decline, that's kind of already like a sign that your mental health has been struggling for a really long period of time. Then you get like the oversleeping, the overeating, and other issues that come up. And so if we treated the problem or the concern that somebody had from the first symptom that they had, where they felt unsafe, they felt uneasy, they felt anxious, they felt depressed, we wouldn't have to wait until it snowballs to something more serious. And then it becomes chronic, or then it becomes a physical problem that you then have to deal with. And I think that because our healthcare system is consistently focused on the physical health of people, the mental health constantly gets ignored. And I work at a pharmacy kind of at the same time as I'm doing my degree. And so I see this a lot with people even my age, like women in their early 20s who are unable to find proper resources and holistic resources between different communities, or that collaborative effort is really non-existent. And then they kind of struggle later on because then they're trying to get that support, but the support is so divided and it's so inconsistent and sometimes inaccessible for people, depending on which marginalized community they come from. It creates barriers for people, and it kind of hinders any sort of growth that they can make. And so they're left to fend for themselves, and then they're left to figure it out on their own. And I don't think that that's what we should have. And I think that it's a responsibility of not just healthcare providers or mental health providers or religious providers, but also any legislative component of our governments to also work together and to create that effort. Because if we're constantly looking at things from that one-on-one angle, then we kind of neglect the whole body. And I think that's kind of how I see community in general. And when it comes to cultural sensitivity, I think that a lot of our mental health services right now are kind of lacking in the sense that it's not just the cultural sensitivity of the current social issue that's happening now. It's looking at historically how people have been raised in different environments and where they come from. And so the intergenerational trauma that Indigenous people face might be different from that of people who come from war-torn countries. And I think that that part of our education system, I don't think is as clear. And I say this as somebody who's pursuing the undergrad in psychology. If it wasn't for me doing a double minor in sociology and political sciences, even I would have that lacking foundation of how to support other people more than just what their mental health is showing me. Like understanding the roots and understanding where they come from give you so much more insight and so much more depth on how to support people rather than the surface level things that you see. And then you're treating symptoms, not actually resolving anything. And I think that would be extremely powerful and something that I'd like to see in our healthcare system moving forward.
Absolutely. And I couldn't agree more about the importance of valuing collectivity. I personally, I'm incredibly passionate in working to make care systems as a whole better. And I don't think it's possible to create a healthcare system unless, as a collectivity, every person in Canada is able to have this feeling of responsibility to each other, to create this value of social care, to create this, raising generations of kids coming forward that, our responsibility is to each other first because we are people on the same planet, on the same earth, and then everything comes second. And I think it's just incredibly important, just the point that you had about healing people and not healing symptoms. It doesn't really work to take a top-down approach to mental health. It has to come from the bottom up. I love that. Would anybody like to go next? Is like a burning question or a burning comment?
Sure, I can add on to what has been said previously. I know someone who once said, I don't believe in self-care, I believe in community care. And I think that's an element that really needs to be brought up in that conversation. There needs to be increased funding, increased supports for social and community initiatives, and especially those that are led by youth. And so I think giving the necessary tools to youth and to allies who are here to support people in need is really key. And I think it also bridges the gap of the lack of mental health support that is being brought in schools and in the workplace. I think it also is a really good element because it builds on the trust and relationship that you have with the people in your community. And I think that's something that's irreplaceable. The trust and relationships that you have with the people surrounding you is something that enables you to be more vulnerable and to be comfortable in your uncomfort, if that makes sense. And I think that's really key in order to access those services. And I think another step that needs to be taken to improve the mental health care system is to build on the momentum of the proliferation of e-mental health services and improve their safety. And so we know that a lot of people are using e-mental health services, but they are not necessarily safe for everyone. So I think it is really important to recognize that some youth don't feel comfortable and safe in their households, and it may even be the reason why they need those services. So I think we need to think of pathways for them to voice their concerns and their distress without compromising on their mental and their emotional and as well physical health. And finally, I think early treatment is something that needs to be implemented as well, and also recognizing our social conditions and the impact they have on our mental health. And so just being aware that some communities are more prone to having those mental illnesses or conditions because of social determinants of health is something that needs to be brought forward, and it has to be mitigated. And there's so much to say, but I think there needs to be even more attention as well as for COVID-19 survivors, essential workers, and marginalized youth, as they need feel more help, more support in those trying times.
Absolutely. I think it's so important that whenever we talk about creating continuums of care, that these care systems include communities and they include youth who face adverse outcomes just for the way that they look, the way that they've existed in the world, or the way that what backgrounds they come from. I think that's incredibly important. Who wants to go next?
I mean, I can go next just to add
Okay.
on what was said. Connor like probably stole all the words from my mouth, everything he said at the beginning. Just the fact that he talked about therapy instead of medication. This is something that's really important for me because I feel like we always focus on, like he said, numbing the pain away instead of like healing is not something that goes like you take a pill and then it's over. Like healing is a long process, and I feel like since we're living in such a world where everything is like I need to get the new iPhone, and sometimes we treat our mental health like that. I need to fix everything as soon as possible instead of doing the process. Even if it's a long process, that's the way you learn to actually heal. And everybody else that spoke afterwards, they all made some good points either about communities or like all the resources. If I had to add something to not try to repeat what they said that was already amazing, I feel like sitting down at the table and being invited at the table by those people that are in charge of the how can I say, of the decision of our mental health, our physical health, or our systems. Recently, in October, I was invited to sit down with the Governor General, and we're talking about the different situation and different ways we could fix the things that she had in her heart for her next mandate in the 5 years. And there's mental health and reconciliation at the top of her priority list, and youth. So just being invited and sitting down, I was probably the youngest at the table. Everybody was like over probably 35 to 40. Just being at the table to be able to talk about, hey, these are the priorities for you. These are the priorities for like mental health. These are the priorities for X, Y, and Z. I feel like this is the way that we actually create change when people let us be part of the change. Because sometimes, like Connor said, we make the situation so general. We're like, okay, let's make something to help them. And yes, it helps some people, but it needs to be specific to each community. And I know that it's a lot of work, but if we don't start this work, we'll never get there. And like he said, we'll just number pain all the time, and nothing's gonna happen. But if we actually take the time to be like, hey, this is the solution for this group, this is the solution for this group, and you ask them and you verify, because a solution that can be for, like, let's say a solution that can be for me will probably not be the same solution for my children if I get some in 10 years. So we need to always check and get updated with the solutions that we're bringing, because the world keeps moving and like there's an evolution, and there's the same thing for us. So like if we don't think about that and we always think that the first solution that we have is the best solution, we're going nowhere. So I feel like sitting down and being involved in the decision, either with big governments or even with smaller organization, is really something that helps us to actually create some change that we want to see in the system.
I couldn't agree more. You know, like everybody thinks that if something is made, if a solution is created for one group, that automatically excludes every other group. That's certainly not the case. It doesn't, giving to one place doesn't take away from anywhere else. It just allows everybody to work more equally towards creating sustainable communities. And you know, everything in mental health care, we are continuously learning about the human mind, about the human body, and our healthcare systems, and the ways that we give care and healing need to be appropriately, you know, dynamic. I couldn't agree more. Aditya, do you have anything to add?
Yeah, and I think the biggest theme with what Easy was saying was about the idea that healthcare is not a one-size-fits-all solution. And it's not just that this has just come up now, it's just the fact that it has never been a one-size-fits-all solution. But the COVID-19 pandemic has brought on these different types of disparities and challenges, and that's just been made more apparent now. And I think we need to, capitalize on the fact that we're seeing these studies come up about the different types of discrepancies in the levels of healthcare and the levels of help that many communities are receiving, and act accordingly. And I think one of the biggest things related to mental health is accessibility. Launching a new virtual healthcare program with telemedicine could be a good solution for somebody who can afford strong Wi-Fi, a new laptop, a web camera, and somebody who has the privacy of their own room to speak to a mental health service provider. But this is not a solution for someone maybe who shares a room with 3 or 4 siblings and does not have strong Wi-Fi. That's probably one of the biggest challenges that have been brought on during the pandemic, and it will continue to do so in different types of aspects, not necessarily with virtual healthcare, but with maybe healthcare and communities. Often the statistics that are brought onto governments are ones from Statistics Canada, and these only highlight the problems that are reported. A lot of mental health goes unreported in stigmatized communities, and then these communities don't get any attention. And this is probably a big challenge that is not as apparent because there's no specific data on it. And I think, as Connor mentioned, you can't just collect data on this. We have to go ask, host focus groups, ask these groups what they want, what they need, how they can improve. And it's easy to say that that's difficult because it's like finding a needle in a haystack. Well, there's a lot of different methods: going to cultural organizations, collaborating with local schools, finding where the problem is, and then asking the people facing the problems how we can solve them, and eventually developing a solution together is the biggest thing that organizations and government can do. And this is through hearing the voices of youth, and not just through advocacy, social media, and panels like this, but rather develop constant advisory groups of racialized youth who can share their experiences and inform decision makers in each step of the process. And I believe that something that is completely missed is that these focus groups should not be used to test ideas, but rather these ideas should be developed with the collaboration and co-creation of stakeholders in the system. And government should advocate to mobilize these community organizations to communicate with local groups. And also things like increasing grants and funding for youth-directed initiatives would be just one step in the right direction. And just as an example, last year, several members of my Youth Action Committee group had the unique opportunity to collaborate with the Provincial Minister of Mental Health and Addictions. But due to the lack of and availability of grants and resources, we couldn't continue the initiative. So there are these options available, but it's hard to capitalize on them when there's not much attention to the side of advocacy, to the side of raising the youth voice. And just to echo what everyone's saying, it's something that needs to be worked on more at all levels and in different aspects that enhance the idea of cross-cultural sensitive practices, and also the whole concept of intersectionality in mental health services.
Incredible. Honestly, I'm not wearing a hat, but if I did, hats off to all of you. That's incredible. Like, I think I'm going to sleep easy tonight knowing that we have future leaders and future advocates who are going to really be pushing for change, and demanding accountability for our leaders today. And just like living in a super capitalist and neoliberal society, care for everybody's individual selves is never prioritized more than profit. And I think one of the main reasons that these grants and these funds are not more accessible and more mainstream now is because it's not seen as a priority to build a generation or build a country that's healthy. Because if everybody was healthy, people would have the things that they need to succeed. Obviously, not everybody can succeed. And it's saddening, but it's also incredibly inspiring to know that youth today are committed to making a change and committed to making our future more sustainable. And I think it's very heartwarming, honestly. That leads me to my next question, which is, what do you want the people who are attending this conference specifically, what do you want our attendees to take away from this conversation? What can families, what can youth, what can other community members, what can even other mental health professionals do to support the mental health of youth going forward? What can everybody take away? What's the so what of this conversation that we're having?
I think that for a lot of people, they go into this work not knowing that they're doing enough, or not knowing if their work will make a difference. And so for me, the big takeaway that I get from these kinds of conversations is that the smallest changes can make such a big difference if we're all doing them. And so before coming to this panel, most of us didn't know each other and we didn't know about each other's work, but coming together, we can realize that we're all chipping away at the same block, and we're all doing such amazing work to come to it together. And so for me, it's really just keep doing those small changes, because eventually other people will keep doing them, and then it'll become just normal to do them together. I think it's so important to have these conversations and to come together and share these experiences, because it's what inspires other people, and it's what keeps the fire going. If I could leave with just a little little bit more. For me, it's decolonize, unlearn, and relearn. And I think that's the only way that we can really move forward with all of this.
Absolutely. I'm not letting any of you go. I'm going to be just consistently stalking you on social media for the next 10 years. You're never going to get rid of me now. And we are absolutely going to go forward together. I'm very excited. Amira? Oh, also, I feel like there was a very good comment by our admin in the chat that the networking session is next, and to stick around for it. I feel like I'm creating a sort of environment of, oh, we're closing off. What do you guys want to leave with? We're not done yet. So Amira, I believe you're the next person to answer this question.
I think for me, the absolute biggest thing is to listen to other people, but not really listen, like hear what they are saying, not with the intent to respond or not with the intent to have some sort of defense to say whatever it is that you're hearing, like really, really hear it and act on it. And sometimes you don't need to respond as much as it is that you just need to hear people out. And I think that for me, the thing that kind of keeps me going is that you don't know how much you're influencing anybody. Like realistically speaking, you're doing your part. You are saying the things that you feel, and hopefully people are hearing you. And so if there's one way I think that we as a community can come together other than hearing one another, is just stand up for what other people believe in. And so I want to bring it back to the point of allyship. I think allyship is so important with any community. So like if you are a marginalized person, it is almost your obligation to support other marginalized communities, because if we're all fighting for the exact same thing, like Connor said, then we're going to see a lot more change than we have in the past. And so I think that part of hearing is definitely supporting other people, and then not dismissing them based on whatever prejudice that you have towards anyone. And I think that hearing younger people, especially like like 16 to 18, I feel like that age group usually gets dismissed, at least from what I've seen. Hearing them and understanding that they have valuable input to put in is really essential. And so I would recommend for anybody who has any sort of position or power in their community to amplify those voices and act on them, not necessarily respond to them. I feel like that's my biggest takeaway from any conversation.
That's great. That's incredible. I feel like I really need to figure out another synonym to use besides incredible, but like I can't think of one, honestly. And I think just this panel this panel is just an incredible example of what transformative allyship can look like in practice. And I hope that I can take what I'm learning forward in my own education and in my own sort of career. Mohab, would you like to go next?
Yes, I'd like to add on. I think the one thing that I would tell everyone is keep the conversation going. I think it's the best way to mobilize for change on this issue. And there's no one who doesn't know anything about mental health. Like everyone has their voice, everyone has their opinion, everyone has something to bring to this conversation, and everyone should have a seat at the table, more specifically youth. I think we oftentimes don't realize the knowledge that we have, the lived experiences that we have, and how they equip us for decision making and also like creating that change. And so I really don't want for anyone to doubt of their abilities, and their capacity to actually create this change. And so myself, I'm someone who often severe imposter syndrome, feel like I don't deserve any opportunity that comes my way, or that I don't have anything good to bring to this conversation. But this is not true. I think we all have our say in this issue, and I really hope to hear more from all of you, hopefully.
Absolutely. Even myself, like I'm always afraid that like when I am given an opportunity, I'm like, but I can't take this opportunity. What if I don't say the right thing? What if I'm not taking full advantage of this opportunity? And it's always that fear that stops us from actually, kind of defending ourselves and saying that, yes, my voice is so important and you must listen to me. And that sort of that thing of imposter syndrome, I completely relate, absolutely. And I think that, youth have such incredible voices, and it doesn't matter how many years of experience you have, it's the experience that you have had in the short time that you've lived. I don't know, like for me, 19 years, not that long, but my experiences are just as valid as somebody who may have been practicing for 23 years. That leads me to Easy.
Yeah, and just to add to what you said, I was talking, especially when I was doing the panel with like I said, with the Governor General and like all these important people around the table. And I remember saying something like, why am I at the table? I was talking to one of the lady that was there, and she was like, your experience is as valid as ours, and we see some things that you might not see. So never be afraid to speak your own truth and speak about what you know, because we can learn things as from you, like you can learn things from us. And I think that you guys need to remember, I know you just said that sometimes you feel afraid when there's some opportunities that you have and there's some things that you're like, oh my God, can I really be in that position? But the same way that we are in the position or we're getting opportunities that seem big, they also went through that. They had to start somewhere, so we have to start somewhere. So sometimes just take the time that if you have an opportunity and you were chosen for an opportunity, it's because somebody out there saw you as the person, the right person to do what you're doing. So and what I feel like everybody can take away from today is that we all come from different paths of life. Some of us are athletes, some of us are singer, artists, whatever. Some of us do a lot of stuff, but we're all here sitting down talking about mental health, how it's important to us. And I feel like we need to understand that it always takes a village to accomplish things. And like in a village, not everybody's the same. We're not all robust. We don't all do the same thing. But when we sit down, when we talk, and we actually try to learn and understand from each other, that's the way that we actually bring change. So don't be afraid to speak about it in your circles, bigger circles, smaller circles, like everywhere that you start to talk about it. Even if it's not everybody, there's probably one person that's going to be interested. And think about it. If you can change only one person, you don't have to change the world. Changing the world is a big thing. It's a big world out there. But if you can change one person or help one person to change or to work on themselves, that's great. And if you do that, let's say one every day, that's 365% that you change in a year. I don't think that you need to do that all the time, but think about it like that. Small steps towards a bigger goal. That's the way I would see it.
Absolutely. Perfect. Just beautiful. Aditya, do you want to go next?
Yeah, it's hard to go after that. Small steps towards a bigger goal. I don't think there's a better way to say it than that. But just a story, like as a youth advocate, it often feels like no matter how much we try to enact change, it's just never visible. And while we do believe that clinicians, decision makers, and government officials are listening, we feel that our passion for mental health advocacy is often viewed as a hobby or just an interest. And all of us were either, students in high school, university, or just starting lives of our own. We do this because we're passionate about helping others and our peers and making a difference. We don't get paid for this work, and neither do the majority of us look for monetary incentives. The biggest incentive for us would be if visible changes made in the system as a result of our advocacy. And whether this is a decision maker, a clinician going and slightly changing their practices, or an executive director changing organizational's policies, little steps or big steps, it makes change in the system. And that's just one message that I'd like to put out to not just clinicians and leaders who are listening, but also advocates who are out there who are looking to do more. And as I think Dr. Sukira said at the Children's Mental Health Ontario conference, that we're all co-conspirators in this advocacy against mental health, and we all need to collaborate and come together. And I think this panel is just one example of that, and I hope there are many more to come.
Yeah. Yeah. I'm running out of things. I am running out of ways that I could possibly agree. I'm like putting my entire heart into this, and all I have left is like, yes, that's it. Just y'all are on this. Like it's beautiful. I'm so glad this is being recorded. I'm coming back to this conversation whenever I feel like, oh my God, is anything that I'm doing actually making a difference? I'm coming back here. Just know that you guys will be quoted in my future assignments. And I think that's a perfect segue to our last question. And it's just that, we've spent so many hours just kind of going over problems and going over things that are creating barriers. And I just want to know, what's one thing that inspires you? What's one thing that gives you hope? It doesn't have to be related to this conference. I just want to know, like, what gets you up in the morning? What gets you going? What gives you hope? And what can the future of recovery, what can the future of mental health care look like? What makes you happy, I guess? We don't have to go in order. Whoever wants to go first can go ahead.
I guess I could go first this time. honestly, younger youth make me extremely, extremely happy. So in relation to the youth guide, I was doing a lot of other community work before. And I think that the biggest thing that kind of constantly gives me joy, pure joy, is seeing a person who was, let's say 12, 13, when I first met them, is now 16, 17, and like physically being able to see how much they've grown gives me so much joy, because one person invested their time in them and they feel like they can do anything in the world. And so if we constantly invest in other people and we are constantly looking forward to their successes, they internalize that. And then they go out and do these amazing things and way beyond what I could have seen for them or what they could have seen for themselves, because we all at the end of the day just want to feel loved, I feel like. And for me to see young people achieve whatever it may be, whether it's a small or big change, whether it's like even like a character trait that they didn't want to have, but they now, you know, they outgrew that, or whatever it may be, or like that toxic friend or the toxic partner, whatever it may be, seeing those tiny, tiny things, like, you know, grow into something more brings me pure joy. And I feel like it's what keeps me constantly going. I think it was mentioned earlier, like we are doing this advocacy work, not for money, not for recognition, not for anything, because 90% of the time it's never even seen. And I think that's how fundamental the change is, because it's that one-on-one interaction that you have with somebody else. And so I think for me, it brings me joy and it kind of fuels me in other aspects of my life and in other aspects of my professional development, or even like school development, or whatever it may be. And I think that advocacy, whenever you see the recognition from other people, it's not as powerful as when you see somebody change the way that they are, something that they wanted to change because you empowered them or you inspired them in some type of capacity, which is why I'm saying like hearing other people, but then also just being who you are in your authentic self is so important, because you don't know who you're inspiring. And so whether that's direct or indirect, people are changing their lives. And I think that it's beautiful to see, because you don't know how far it can go. And I think that part of like lack of limit, I guess you could say, is so huge. And so it's exciting and it's inspiring to see whenever any community or any person does something beautiful. And I think honestly, I got the same energy boost from this panel, because this work is so amazing and everybody's doing such great things in their own little niche, and then it builds up. And so I think it's just, I'm inspired. That's all I'm gonna say.
My mascara is gonna start running soon. My voice is cracking. Somebody else speak quick.
I mean, Connor.
Go ahead.
Okay. So I was gonna say that I feel like if there's something that inspires me, like especially my work at jack.org, a little bit like Amir said, when you're speaking, like yes, like the panels and all the big initiative that we do is really inspiring. But when you sit down with somebody, or somebody comes up to you and they're like, hey, whatever you said there, like I really need that, you feel so much joy and so much fulfillment from actually seeing that you're helping people. And I feel like just seeing everybody in this Zoom right now being like, hey, we really want to change things, it inspires me. And I'm like, okay, like we're not alone in this change. And even if it's about mental health or other like social justice or anything else, every time that you're doing some small steps, or that you're actually trying to work towards a better goal, like I said earlier, and you see people coming and starting to get involved, this inspires you to keep going. And I feel like we need to remember that sometimes there's some bad days and you're like, yeah, man, I'm not feeling well, this is not the best day. But remember that for those small bad days, remember all the good days and all the good work you've done, and keep pushing. Like we need to push. Sometimes, yes, we need to rest. Think about that. Don't overwork yourself, guys. But we need to keep pushing and to get the help from everywhere. Right now, we're a lot of people from different places, but we all have the same goal in mind. So like, don't be afraid to continue to shine your light on. I seen that somewhere in the comments. Continue to shine your light on in your circle, and that's the thing that inspires me and gives me hope every day when I'm doing that type of work.
Connor, Mohab, Aditya, who wants to go next?
I can go next. So what is one thing that inspires me and gives me hope? What gives me hope right now is our sense of generativity. And generativity is a term that I learned recently, and basically it refers to our desire to make a change. to promote the well-being of future generations and also to leave a legacy behind us. And I think that it's our sense of generativity that gathered us all today, because we have this strong need to improve the current state of affairs. And so our sense of generativity is like when I see youth getting involved, starting programs, participating in events, or just being there for their peers is what gives me hope that our generation is going to do great things. And to reply to the other questions, I think was like about the future of mental health. I hope that it's going to be one that is dynamic, evolving, fast approaching, and also generative, because I really think that the future of mental health care and recovery is one that will foster diversity and inclusion, will bring an emphasis on community care, and that will be much more accessible for us all.
Incredible. I'm so sad that this panel is coming to an end. So I feel like Connor and Aditya, you guys are going to be closing off. Yeah, it's just the future is looking so bright. Perfect. I'm happy.
I can go next. I think going after all that is very difficult, but I think everyone's highlighted a lot of the important points that have given us hope, as like collective hope almost. And personally, what I feel often is the advocacy, as I said before, is challenging, and it often feels like the needle has not been shifted. But small changes in organizational practices really do give me hope, and it gives a sense that there are people out there listening to our voices. And I wish for even more of this to happen as we increase our understanding of things like race-based mental health challenges. Just a quick story: I've been working with the Reach Out Center for Kids on different community projects probably since I was in grade 9, and doing different types of advocacy on the importance of youth involvement and youth engagement. And I led a project to create the e-learning module I mentioned earlier. And just recently, last year, I was invited to join their executive project, which is to create a collaborative crisis services outline. And I was the only youth representative at the table to see the executive directors are taking initiative to ask youth and hear that youth input on the executive table is something that I saw right throughout, right from being just someone advocating for it to someone sitting at the table. And I think Easy also highlighted how valuable that is. I was sitting there at the table with the CEOs of this organization thinking, why do I belong here? How can I contribute? But having that opportunity, that domain to share my voice really gave me hope that this is just me and one small organization doing this. How many more youth can be doing this all over the province? And now seeing this national panel, how can youth be doing this all over the country, not just for mental health, but for any types of social justice? How can more youth be involved, and how can that youth voice be raised? And today really does give me hope. Being here with advocates across the nation, having a platform to speak is what makes me proud to be an advocate for mental health and wellness. And just seeing the work that everyone has done is very significant, and it's something that we should be proud of. Often we don't see how important and valuable our own work is, but just hearing all the people in the chat, the words of encouragement has really done a lot to give hope. And just to go on that next part, the future of mental health care and recovery, I believe can look like a safe place where all members of our society have equitable access to care and they're treated equally, and where individual experiences and challenges are heard. And just in general, that healthcare should be viewed from a mitigating lens, not a remedial one. Healthcare should be viewed in how can we support each other and how can we bring each other to be the best that we can be, whether that be physically, mentally, emotionally, spiritually. How can we achieve that optimal sense of self? And I think that's the biggest thing and the biggest journey for all of us. And just seeing everyone contribute to that on different levels, seeing people support each other through this pandemic has really given me hope on where our society can go. And just touching on that thing about generativity, how can we all embrace that in everything we do? How can we do things for the future generation and leave a legacy behind for the work that we've done? So I just also like to thank everyone on this panel, because it's been very inspiring and honorable to speak alongside everyone here.
Couldn't agree more. Connor, if you have any last closing sentiments, it's on you, I guess. I'm sorry to put it on you, but you're the very last person to go.
Yeah, of course. All of you inspire me. That's why I'm here. That's why I wake up in the morning for everyone like everyone here. But certainly for me, my culture is what inspires me. Learning my culture, learning my language, every day waking up and seeing my friends and I learning our language and then teaching our parents our language and then teaching our grandparents and our great grandparents, and being able to renew that legacy and that heritage, I think for me is what allows me to wake up every morning feeling proud, is to find those stories and to share them. For me, we have this saying called Minobematsu, and it's searching for that good life. And for me, searching for that good life is what wakes me up in the morning and what puts me to sleep every night, because that good life comes with balance and it comes with the ups and downs. And it's not about just living inherently good and everything is fine, but it's about keeping everything in balance and keeping everything in check. So I just like to say, Shimigachi Kinawea, thank you so much, everyone. It was just so amazing talking with all of you.
Absolutely. I feel so honored. I could go on for hours, but I think I'm going to give it to Noor to introduce our next section. From the bottom of my heart, truly and honestly, thank you so much for giving me the space to do this. I really appreciate all of you. I'm so excited to stalk you guys and never let you out of my sights. Go ahead, Noor.
So thank you once again. The work that our youth panel has achieved is like incredibly motivated. I know Shafia has said it already, but thank you once again. And next up, I'm very excited to introduce our musical performance by none other than Laz. So Laz is a creative artist from Toronto's West End. He's made a name for himself, releasing several singles and performing all over the city. So without further ado, we have Laz.
Hello. Can everybody hear me? Can everybody hear me? I just want to make
Yes,
sure
we
everybody
can.
Okay, good. Okay. My name is Laz. I go by the name of Laz, aka Last That Sleep. I do different genres of music, but right now I'm just gonna get into it, let you guys hear it out. I'm gonna be doing 2 songs for you, and I came a little bit late, but I was even enjoying the short talk that I got. Right now, I'm just cooling in some jeans and a little wrinkled and one thrifted tee. So that just to set the vibe of what I'm going for right now. Some more chill stuff, some more relaxed stuff. But yeah, rock with me through this, and we're gonna get through it. Let's go. Yeah. Oh yeah. No. Hey. You've got to get a hold of yourself. Stuck in a cycle and I'm spinning a load of dirty clothes from past times with different women. Troubles after forgiveness, still complain about the dishes. Dark cloud of steam from the washing machine. Ding. Problems after progress just to start over again. I'm rubbing off the dirt from the hole that they got me in. Sand slipping through my hands, dust still on my skin. Trying to be the bigger man. White rat feel like Kylie Jenner. Quarantine brands. Lot of uncapped potential. They put an end to privacy so I don't text sentimental. I feel lit with my track, got my brothers on. They want me to move solo like a brother, jumping trigger songs. Last wanna put the city on. I'll start it from the bottom. I'm locked down in this house and my mom thinks I'm the problem. Really just trying to solve it. Wash away with the nonsense. Suba River and garbage. Tiptoe through the Garden of Eden where it all started. I hate to be that guy, but females, I never got them. My exes don't know why I cut things off or sing about them. Think I can live without them. These shorties must be clowning. Why lock me down with issues to tend to? I'm really sentimental. I'm used on instrumental. And this one's for your mental. Yeah. I said I'm really sentimental. I'm used on instrumentals. And this one's for your mental. I said, stuck in a cycle and I'm spinning a load of dirty clothes from past times with different women. Troubles after forgiveness, still complain about the dishes. Dark cloud of steam from the washing machine thing. So that one's called Cycles. That's one that I perform quite often. I wrote during the time of quarantine. So I don't know, for me, we're just kind of rap camping it. Actually at my cousin's house where I'm live streaming from right now. And we were just sitting down,
I wish he performed his verse. He has his verse that starts like time to pour some, like something about like I'm sitting on the floor looking at the sky bored. Like that's how serious we were, like just in there in the room, focused, writing, just trying to like escape our little mental war and doing our thing, at our craft. But yeah, so that was called Cycles. I'm gonna get into the next one. I like this one too. Really love this one. It's from an upcoming project. It's an unreleased song. So I think it's fitting for what we're going for. So I'm gonna perform it. It's called Love Letters. And yeah, I'm just get right into it. Ooh. You guys enjoy the first one though? Like everybody's on mute. This is so different. Like, am I supposed to be checking the chat? Ooh, we got an ooh in the chat. Shoot, I wasn't checking the chat at all. Oh wow, let's see what we got going on here. Awesome. Yep. Okay. I like the feedback. It's a little different before it online. But yeah. Okay, we got it connecting right now. Everything should be fine. And I'll run it from here. Should be no problems. All right. So this one's called Love Letters. Like I said, it's an unreleased song, so and this is the first letter, because I plan to do many more, So here we go. I love you. It's the first letter. Yeah. Stamped and sealed. Oh, okay. I love you from you know who. I wrote these letters. It feels like forever. Still in my room. Yeah. Missing addresses. I send you this message. Yeah. Stamped and sealed. The wax might peel off my thoughts to you. To you. Look, papers after papers, they ain't got no dates because my memory's been faded. Trying to balance weight, deadlifting all these feelings. So how can I leave them? You could call me crazy, but the first step is believing. Trust me, we're beautiful even though things been ugly. I left a teardrop on the page. I wish this was a phase, but for years I haven't changed. These ballpoint pens ain't leading me to the way. I'm running out of ink. I'm painting different pictures, hard to tell you what I think. Flowing till we deep in level, draining out the sink. 40-second flows, these are views you shouldn't miss. I'm drizzy off the licks. I'm hoping you can sip, reminiscing of your lips. Past times been flashing, lights look like cameras. I can make you famous to whom this concerns, but right now I leave you nameless. Seals envelope. You know who. Hey. I wrote these letters, it feels like forever. Still in my room. Yeah, mission addresses. I send you this message. Sandy seal, the wax might peel off my thoughts to you, to you. Yeah, thank you very much. That one's called Love Letters. And if you guys rock with the music, you guys can find me on all social media platforms at Lost That Sleep. So also like my AKA what I go by, the name's Laz, but you can find me everywhere at Lost That Sleep. Yeah, you know what I'm saying? If you really did enjoy generally what I did, it might be a little bit different to some people. It might be regular, you know what I'm saying? But, just check me out. I'm cool to tap in with everybody. I love the space. Like, you know what I mean? Even for the bit that I heard and like what Nana was talking about, what Ezekiel was talking about. It's really good like to see that there's this much people. Like right now there was 100 or something earlier. Right now it's 98, but like this much people coming together just to kind of like enjoy other people's time and space and hear each other's voice and everything. So it's it's very, very much helpful for me. I don't know about everybody else that's in here, but like stay in contact. I love to stay in contact with people. And yeah, thank you guys for the opportunity to do this. This is fun.
No, thank you so much for the amazing performance. Like you should leave your socials in the Zoom chat so people can check you out and like see more of your work.
Okay, in the chat, yeah. Okay, I'll just type it in the chat. That makes it way easier, honestly. But yeah,
perfect. Honestly, a lot of people are hyping you up in the chat.
I know I'm terrible with like reading the chat because like I'm just kind of like, you know, zoned in doing my thing. And like honestly, like when you do this, like I be rehearsing, I still forget my lyrics, like no cap. I'll rehearse and still forget the lyrics and everything. So I'm just here like not like, you know, not in my head trying to get into my zone. But I'm definitely going through the chat right now as I'll be in here, and then I'll tap in with everybody who else follows and whatnot, you know. Thank you guys again. This is so much fun. Yeah. Haven't performed in a first performance of the
Up
year.
next, we do have. Oh no, we'll have many more, I'm sure. Okay, so up next, we have a networking opportunity. So we want to give all our attendees the opportunity to network with some like amazing organizations. We have Kids Help Phone, Canadian Mental Health Association, YWCA Hamilton, Smile Canada, Nasiha, ABRAR Trauma, and someone from ABRAR Trauma Mental Health Services. So the way this is going to work is we're going to be putting you guys in breakout rooms for 7 minutes. And if you want to go into sort of look at different organizations, you'll have the option to switch between different organizations and see which one you want to participate in. And so yeah, this is sort of the opportunity to ask questions, be curious, and get connected.
All right. Well, hello everyone. Firstly, thank you for having me and congratulations. I don't see ABRAR on the screen, but huge shout out to ABRAR and this really mighty team. I'm getting a notification to enter a breakout room. Okay. Anyway, you know, I had the opportunity to attend the conference last year and it's just come back stronger and so much better. And I'm really thrilled to be here. So much of what was said through the conference resonated with me, and you know, hearing from young people and their experiences, and really, you know, someone was mentioning around not feeling that you're up for the opportunity, and I really feel like that resonates with me because I'm one person leading newcomer initiatives at Kids Help Phone, and that can be so daunting, but it's been a really collaborative process to hear from young people, to attend conferences like this, and really have that informed approach. So thank you for organizing this. A little bit about myself. My name is Ravina Anthony. I use the pronouns she, her, and I have the pleasure to lead Kids Help Phone's newcomer initiatives, which focuses on our programming specific to this population. But I also work in conjunction with our Black Youth Initiatives Manager and our Indigenous Initiatives Manager within the broader framework of inclusion, diversity, equity, and accessibility strategy. So I do have a small presentation here so I can start sharing, and hopefully it should go. So can folks give me a thumbs up whenever you can see that? Awesome. All right. So as most of you might know, Kids Help Phone is Canada's only 24/7 e-mental health service, providing free confidential support. As the country's virtual care expert, we give millions of young people a safe and trusted space to talk over the phone, through text, or self-directed support in any moment of crisis or need. We offer a range of different wellness services to however young people are comfortable to use our service. The main service is around phone counseling, which is offered through professionally trained counselors, anonymous and confidential, free 24/7, and specific to newcomers. We also don't collect any identifying information or legal papers and permissions. The service is offered in English and French, and very recently we've opened it up to Arabic populations as well, with the hope to continue this journey to offer many more languages. Along with that, our professional counselors also offer live chat counseling, which is offered at times when we see a high call volume between 7 p.m. and midnight. We also offer texting support, which is probably our most used service. So we have, we know that young people love to text, so that can be over the phone through
through our code 686868, or it can be through Facebook Messenger. Support is provided through trained volunteer responders who are spread across Canada and help a young person in need of support or in a moment of crisis. It is free and 24/7, just like phone counseling. The only difference is that this service is actually open to adults as well with our partnership with Wellness Together Canada. So adults can text in at a different number, which is 741-741. Our latest service, which is probably new to a lot of folks, is peer-to-peer community, which is an online community of support for young people across Canada, where they can privately share their experiences, offer inspiration, and ask questions to connect and comfort and cheer each other on. And in this platform, we have many different conversation threads and topics. So it's sectioned off by community, whether you're a newcomer belonging to Indigenous communities, other people of color, or you can also look for conversations according to some issues that you might be facing, like isolation or anxiety. So it's a really robust platform, and we launched it last year, and it's so far been very successful, and I encourage young people to check it out. And lastly, we have a tool called Resources Around Me on our website, which is if a young person reaches out and feels that, Kids Help Phone might not be the best fit, and I'm looking for a service, closer to my geographic community, or a service in a different language, or a service that specifically supports Black community or another community, we have an information and referral database, which can also be filtered through according to location, language, and communities. And of course, we're always building on this platform to make it more robust and comprehensive for young people to navigate resources. And lastly, we have a lot of website content, which includes educational material and information and tip sheets. We have a host of different content speaking to different populations across our website, but here are just some snapshots of some that we've developed for newcomers. So things like, transitioning into a new country, wellness tips, counselor Q&As, and this is the page that ties it all together, which is kidshelpphone.ca/newcomers, where you can find all of our newcomer-focused services. There's also a page for adults and supporting caregivers at kidshelpphone.ca/supporting newcomers. And of course, if you want to stay engaged, you can choose to follow us on social media. That is it. Thank you. Stop share. Oh, thank you, Yvette. Are there any questions?
Oh, thank you so much. Thank you so much for the presentation. Yeah, is there any questions? Does anyone have any questions? You can leave them in the chat, or you can raise your hand and then I can unmute you.
We do have our logo on candy wrappers through our partnership through Nestle. So if you buy Smarties or a Kit Kat, there's a little logo there, which I know a lot of young people find really cool. So we're really blessed to have good partnerships. Thank you. Well, if there are no questions, I'm around for the rest of the conference, and I'm happy to to network and to answer questions individually. And also I can drop my email in the chat if anyone's interested in connecting later on.
Also, I wanted to let you guys know, if you wanted to look into any of the other organizations, you have the option to do so on the, to switch to different breakout rooms. Yeah. Also, Ravina, I had a quick question. How would someone get involved, like a youth want to get involved with your organization?
Thank you, Noor, and that's an excellent question. So we have a number of opportunities. So we have a volunteers page where you can sign up for various volunteer opportunities that keep coming up throughout the year. And in addition to that, we also have a National Youth Council that I'm not sure how regularly, but every few years they recruit. And I understand that we just had a cycle last year where we renewed our youth council, and that youth council mainly is the voice of youth that informs most of our services and programs. Apart from that, for specific initiatives, so for example, I mentioned the Arabic phone counseling service. We also engage with specific communities. So for the Arabic service, we engaged with specific Arabic-speaking newcomers across Canada. For Black youth initiatives, we engaged with Black identifying young people across Canada. So there are those specific opportunities that we work with other organizations to have youth involved, but there's also broader opportunities that come around every year or every few years for young people to involve themselves with Kids Help Phone.
So for anyone new joining us in the breakout room, we have with us Ravina from Kids Help Phone. So if you guys would like to ask any questions, feel free to do so in the chat or raise your hand by using the raise hand function.
Well, while we're waiting, I actually had a question for the research group. If anyone is available, I saw that this year you engaged around 500 plus young people, and I was just curious, how did you manage to get such a big number? I know it can be challenging to get youth to participate.
Yeah, I can answer this. I was a part of the research team as well. What we did is we emailed it to a lot of organizations and we shared it on Instagram and like other social media platforms. And we really wanted to target youth around us and like youth around Canada. So that's how we did that. Bless you.
Thank you. Thank you. I'm having a bit of throat trouble today. Hopefully it's nothing.
Yeah, hopefully you get well soon.
Thank you.
One question for you. What would you tell youth that are struggling with their mental health and maybe can't access paid services? And like sometimes these like Kids Help Phone where you can call in for a little bit. What kind of suggestion would you have for like long-term wise?
Well, I would say reach out. Definitely reach out, because even though Kids Help Phone offers single session counseling, there's once you reach out for support and at least one other person knows that you need that support, chances are higher that you will find your way to other paid supports or long-term supports. Apart from the resources around me, which is our youth-facing portal on our website, we have an internal database which is much more robust and available to counselors. So chances are that they'll be able to find an appropriate resource to direct you to, whether paid or unpaid. So definitely reach out. Don't be afraid. Don't feel afraid about the stigma. Counselors also feel a lot of anxiety around, what if I'm not able to help a young person? And when we were launching the Arabic service, there were, concerns around, I don't know the culture. Our training implied that you don't necessarily have to know an entire person's entire story to be able to help them. So that's the whole approach between being culturally competent and being culturally humble, right? So if you don't know, ask. And that's the same thing I would tell a young person. If you don't know, reach out and ask them, and chances are that you'll get the help you need, hopefully.
Yeah, definitely. I love that message for youth who are struggling. If they have the opportunity to reach out to one person, even, it makes a big difference for them.
Okay, perfect. So I hope everyone took the chance to sort of network and communicate, get involved during the network sessions. And so now we're going to be doing sort of a mental health activity. What we had in mind is we wanted to hear from you guys, from all of our wonderful attendees, with a word cloud activity. So in a moment, you'll see some instructions pop up on your screen for a website and a code. And we want you guys to enter in some words about how you feel about taking care of your mental health this year. So I'm gonna start sharing a screen, or sorry, my team is gonna start sharing a screen. And then, yeah, we're going to be able to see sort of the overall reflection, how our group in total thinks about mental health. So yeah, guys, go right ahead. Okay, so I'm seeing a lot of good answers. I definitely resonate with the sleep one. I think a lot of people are putting that in. Vacation, moving your body, joining a therapy group, meditation, prayer, self-care. These are all really good answers. And so we want you guys to see what pops up, like a lot of similarities that are showing up. For example, taking breaks, exercise, sleeping, and find some way to incorporate that into your routine to help your mental health this year. Yeah, I think we'll let it go for a couple more minutes, see what other answers come in. I'm sure everyone has access, but if you guys don't have access, feel free to put it into the chat how you guys are feeling about this exercise. Self-care, eat healthier, that's definitely a struggle for me. That's a very good point, Fatima. Be gentle with myself. That is a really good advice. Helping others, yeah, that's a really good point. Meaningful connections, I think that's another good point. Enjoying nature more, especially I think at least here in Toronto, we've been having a lot of snow. So I'm gonna be that. I'm gonna definitely gonna be enjoying that. Being present, yeah. Yeah, it's very easy to once you get into the flow of things to start picking up patterns, and once you start incorporating these into maybe your daily or weekly routine, hopefully you'll see a lot of improvements in your own mental health. I think the first step is just recognizing what needs to be done. Believing my truth about me. That is very profound, actually. I really like that one. And then connecting with my community. These are a lot of good points. Okay, I think that's gonna wrap up the mental health activity for today. Thank you guys so much for participating, and I hope you guys got a lot through seeing other people's answers and maybe thinking of things that you probably haven't taken into account. I know that was the case for myself too, like meaningful connections. I really like that. So I know you guys have heard me talk a lot during this conference, but before I pass it along to Jannat and Fatima, I want to mention that we here on the In This Together team, we really want to thank you for your attendance. And in doing so, we want to have a feedback form with the link in the Zoom chat. So we want to hear from all our attendees from today's conference. So if you fill out that form, you'll be entered into a raffle to win one of 50 gift cards. So the feedback form, unfortunately, it's just for the youth attendees that are eligible. So I'm so sorry for the representatives of the organizations. We love you guys, but you have to sit this one out. So once again, the link is going to be in the Zoom chat. And that's it from me. So now on to Jannat and Fatima. Go ahead.
Hi, everyone. Thanks again for attending our conference. I'm Janet, and I'm one of the conference coordinators alongside Fatma. So as a whole team, ABRAR Trauma and Mental Health have worked tremendously hard these past few months to plan this conference. We're so grateful to have the opportunity to share our work with you. From our entire team, we also want to give a huge shout out to the Genius Pro and the whole conference ABRAR. She has worked tirelessly for the past several months and has made sure her team was comfortable the entire time. She's an exceptional leader, and her vision for this conference only grew despite the many setbacks and concerns. So ABRAR has made this conference so meaningful, and we couldn't ask for someone better as a leader. So Fatma and I have worked behind the scenes helping out with the logistics of this conference, and from the bottom of our hearts, we want to share how much of a meaningful and important and impactful experience this has been. Go ahead, Fatma.
Absolutely. And just, I wanted to share that behind the scenes, our entire team has worked so hard to actually expand our team even more and build our capacity to give back even more in 2022. So I know you guys have already seen the announcement, but I just want to reiterate again that we are ready to take ABRAR trauma and mental health services to the next level as an incorporated business. And on that note, I just wanted to share with you that we have a series of really new and really exciting partnerships coming up, and our project leaders who are present here with us and who you've already met are working hard on creating more and more engagement opportunities and support opportunities. So please do stay tuned for that. And also our professional team, very exciting, we announced them a little while ago, are also working on creating a service provider structure that's going to allow ABRAR trauma and mental health services to take on more clients and provide exceptional and very unique mental health support and counseling for specific populations. So yes, we are coming to the end of this conference, and as this specific conference is over, we just want to let you guys know that this isn't over. Like, the end of this conference does not mean the end of this community that we've built. We are open. Our DMs, our I guess our email, we are all open to you guys, to our community that we've just built here today. And if you guys ever want to support us, if you want to volunteer with us, if you need any type of support from us or any type of services or projects from us, we are here to help you and we are here to connect. So please don't hesitate to reach out at all. Yeah. I'm going to pass it over to ABRAR, who's going to give us a little.
Let's keep us there of us spotlighted. I mean, I wouldn't agree on the script. Anyways, thank you so much. No, like, I really have no words, and I'm so I'm gonna cry today because I couldn't believe that we as a team were able to make it so far for 1 year, and I'm really so lucky to have such a wonderful team behind the scene. And first, alhamdulillah, which mean in English, thank God. We first it goes all to, alhamdulillah, everything has been really, it's such a good luck. And after that, it goes to the amazing team. We have, as already you mentioned, all. Stay tuned for our next, and I have great shout out to Jannat. She was sick and she had her birthday yesterday, and she never left us alone organizing that conference, and absolutely the wonderful and amazing Fatma, also our admin team, and to everyone behind the scene. I cannot we are a big team, but they know themselves. Our research leader, Amani and Rabia, you were phenomenal behind the scene. Hell yesterday helped editing the report till 4 a.m. Hell, huge shout out to them, to everyone, and to our partners again. Thank you so much for Billetstock, our sponsor Billetstock, YWCA Hamilton, and the Student Commission of Canada, and to our supporter and partner again, Jack.org, Kids Have Fun, Same Bill Different, The New Mentality, BAM Collective, and Youth Graffiti. And please remember me, if the Mental Health Commission of Canada and YMCA Canada, we had great attendees from there, and the YMCA Canada. We're really honored to have your support today, and I'm so sorry if I missed anyone. And to everyone, our panelists, you were the hope. I'm just gonna say that you are the hope. And yes, please stay tuned for our project and what coming next. I think we will be publishing a new project coming up soon by the end of February, hopefully. And stay tuned to our published report. The one already has been shared at the beginning, and I don't think we missed anything. So our report will be published and announced and publicly shared, and the recording will be also uploaded to our YouTube. So please stay tuned. You can always follow us on website and on social media, and you can connect to us as already Fatma mentioned in any way. What's anything, like we're there, we're accessible. Alhamdulillah. That's what we're trying and promoting for. So accessibility is, our first goal. And yes, and that's it. Please stay. Have a wonderful night. If you have anything to add. Oh my God. I know I'm gonna forget. The biggest huge shout out goes to Noor Sayed. You were phenomenal. You were amazing. You were awesome. And absolutely, yeah, you were wonderful. Your funny personality added a lot to yes, Noor, absolutely, Noor. And also our moderator, Shafia. And behind the scene, we have the tech support again, Layla and Jasmine from Canadian Arab Institute. A huge shout out to you. And anyone who is supporting the tech, Ahmed Hidhod too. Who else? Mateen as well. And yes, you can spotlight the team if they're here. Okay, who else? And absolutely, today our media coverage was moderated by our marketing team. Special shout out to Alia, Al Hamoud, and Fadi, Khouri, and Dunya Raba. They were amazing, making sure everything. And Amira Youssef also for her support, and Amira Abuta also from our team. And yes, that's our team. You can unmute yourself, say final words, and please enjoy the rest of your day. And Madison, absolutely. Yes, I'm gonna be terrible with names. We have a big team, but absolutely everyone who put any effort toward this conference to be amazing and successful as of it, huge shout out to you. Alison, I see your message. Thank you, Alison, for being a great supporter from the beginning. Ravina Kitzhafan did a lot for us today. And absolutely huge shout out to our interpreter, French interpreter, which was done by Barbara Scheffler. I'm bad with names. Anyways, but yes, thank you so much for being behind the scene interpreting such a long conference. Yes, I mean, that's a lot. And I hope I did not forget anyone. Please enjoy the rest of your evening and good night.
Bye, everyone. It was so nice to meet you and speak with you.